We're alive, guys.
Happy Monday, everybody.
It's Monday already, huh?
It is Monday.
Feels like it's Sunday, actually.
I feel like I've been sitting in this chair for 4 hours.
You have.
Well, almost 4 hours.
Almost 4 hours. Almost 4 hours. But happy Monday, everybody. TGIM, it's 5 o'clock somewhere. We want to thank our returning guest and friend, Dr. Irene, for taking time out of her very busy schedule to be with us.
Are we friends at this point or not yet?
Yeah, we're friends.
Yeah, okay.
Colleagues, friends.
Colleagues.
Ooh, very professional. Colleagues.
Keep it,
colleagues.
keep it professional.
Colleagues.
colleagues. The last time we had you on was 2 years ago.
No.
No, it was last year.
No. It was on my birthday 2 years ago.
No, it was
How
last
was
year.
it 2 years ago?
I
We
swear,
was
it was last year. I swear to God, it was last year.
I was turning 38 when you were here. Or 37.
It was at the studio.
Yeah.
It was last year, guys. It was like a few months ago.
Talking about.
There's no way it was last year. What are you guys talking about?
Okay.
Really?
Look it up.
Okay.
It was November 18th of 2024.
Really?
Yes.
Wow, time flies.
Here we go. This is the part I love. This is the part I love. Watching.
So it's been how long you said? 2 years?
It's almost 2 years. Year and a half.
November of 24.
Boom.
Oh my God.
Yeah.
Okay.
Year and a half.
I apologize.
It's
You are
okay.
correct.
You know?
It's a year and a half.
Almost 2 years.
Okay,
Do we
year
need
and a
some
half is
therapy right
almost
now?
2 years or almost 1 year.
Is the glass half full or half
Yeah,
empty?
says the guy
I'm
who
going to put my tea down for this one.
who still thinks physics doesn't have any math.
We're way past that.
Are we?
We're way past that.
Thank you, Jesus.
By the way, I was having a conversation with Alan G when he was here, and I was asking him, I'm like, can you bring an astrophysicist on so we could have a discussion with them? He was just like, look, it's very difficult to get one of those guys on and blah, 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 blah. But anybody who knows an astrophysicist, we'd love to
I
have them
wonder
on.
why.
They're just weird.
No.
What?
Do they really want to answer any questions?
I don't know.
Yeah, exactly.
But
That's a good point.
today we obviously we went live with Dr. Irene to discuss a very sensitive topic. An incident took place a couple days ago in the Armenian community. And it, again, I don't mean to say it in the Armenian community. It could happen in any community, whether you're Armenian, whether you're Latino, Hispanic, it doesn't matter. But an incident took place where a family of 4 was involved in a alleged murder-suicide. And again, I'm saying alleged because the full story hasn't been released. Names haven't been released. And obviously we are not planning on...
Well, names have been released.
All names haven't been released.
They have. All names.
Including the mother? No.
Of course.
I haven't seen it yet.
Pictures, everything has been released.
Well, I'm talking about, not on social media. I'm talking about as far as news. I haven't seen the mother's name. That's the only reason. But anyways, a tragic event took place. And look, a lot of stories have been circulating around. And the one thing we want to beg and plead to everybody is just stop spreading rumors. If you don't know something, don't say it. Because unfortunately, we live in a society where the game broken telephone works wonders. Everybody's freaking telephone is broken. Everybody hears a different story and it gets misconstrued. And all of a sudden it becomes this Lifetime movie. And we just ask everybody to stop in respect to the family because they're going through a very, very difficult time. Now, the one story that we have been hearing is that a 2-year-old was involved and a 6-day-old was involved. Originally, when the story was released, they said a 4-month-old was involved. And then we heard now and confirmed that it was a 6-day-old. And everything pointed to a condition, which obviously is why Dr. Irene is here with us, was postpartum depression and postpartum psychosis.
Mm-hmm.
Very quickly, can you elaborate on the difference between those two?
Yes, absolutely. Now, before saying that, though, we're not diagnosing her with that.
No, we're not. No, we're not. These are stories that
we don't know her.
Have been told by individuals that are saying that this is what she was going through. But again, none of us are here to diagnose her or confirm anything. It's just a lot of the dots, I guess, would kind of, or stars align when it came to possibly what happened to this individual?
So there's 3 different types of postpartum things that a woman can go through after having a child. And one of them is postpartum depression. The other one is postpartum anxiety. And then the other one is postpartum psychosis. 3 very different. So with postpartum depression, we're looking at about 1 in every 8 women seem to be experiencing that after childbirth. And it could last between several months to about a year. It shows up after a few weeks, after a few months, it can also show up. And it's more of like that depressed mood, not being able to attach to their child, not being able to feel like they're connecting to the people around them or specifically their baby. So it's the depressive symptoms right after postpartum, right after having a child. When it comes to postpartum anxiety, that's about 20%. Actually, more women experience postpartum anxiety, which is not talked about often, than they experience postpartum depression. Postpartum anxiety is when a mother has a baby and they're overly worried about everything. They will not leave their baby with their in-laws or their own parents. They have separation anxiety. They're constantly worrying. They're not able to stop worrying. And it's very, very common. And it's very sad and it's very prevalent, especially in our community. I see it often. When it comes to postpartum psychosis, it's very, very rare. That is when you literally dissociate from the reality that you live in. So it's a rare condition. It's a very serious mental condition. It can happen for many different reasons, but it's postpartum depression, anxiety, and psychosis are totally 3 different things. So we can't classify them. A mother who has postpartum depression, they're not going to go and try to hurt their child.
Yeah, the anxiety one is the one I think we can all kind of, I don't want to say relate to, but have seen more often. Because we've heard stories of the helicopter moms, the moms who refuse to have the grandparents babysit, who are always staying home, constantly attached to their children. In fact, I mean, I've heard stories of moms who have been terrified of their children being kidnapped, so they're constantly holding them, caressing them, and you know that alone, as far as raising the child and the kid getting used to you kind of cradling them and holding them, becomes a different topic in its own. But I think the anxiety one is the one that we're most commonly I guess familiar with.
But we also have to be very specific, because it's not just because a mother is anxious doesn't mean she has postpartum anxiety automatically. It really has to get in the way of your social, occupational, familial functioning. So any mother can have depression, any mother can have anxiety. Very normal, especially after you have a child. All the chemicals in your body and the hormones and everything get all mixed up. But when it starts to affect your life to the point where you're not able to leave the house, or you're not able to enjoy your baby, or it starts to get in the way of you connecting with others, is when, mental health professionals come in.
And there's also another one that's only lasts for a short period, right? Which is called baby blues. Yeah.
That's right after you have a baby. But it doesn't last too long.
Because typically the ones, from what I've seen, is the ones that have the postpartum depression tend to kind of prolong getting pregnant again, right? Which could be 4, 5, 6, 7 years before they have a second child or the third one.
I don't know about that. Yeah.
So which one is it where, because there's a lot of women out there who, for example, will have their first one and they're fine. Or maybe after the second one, they'll develop some type of PPD. And then it will take them years to kind of overcome that depression, to be able to have another baby, another child. So what is that one referred to then? Anxiety, or because it doesn't sound like it from your definition, it's anxiety.
Individual based more. I mean, my practice consists of 50% of our patients are postpartum.
Really?
And so, yeah.
Wow.
And so that's specifically what we do, is we work with trauma and postpartum addiction, but postpartum is a very prevalent one. So a lot of the mothers, I've seen maybe they've waited like about a year or 2 maybe. But sometimes what happens is they just want to have their other baby so they can get it over with. But I mean, when we think about if they're waiting a long time to have another child, I think that's just individually based. I haven't really seen a correlation between them being depressed, anxious, and then having a child later on.
I think that might be kind of like I don't want to say a cultural thing, but maybe they're just overwhelmed with the first kid. They don't know, they don't have the help, they don't have the support. They're trying to raise a kid. They don't know what they're doing, trial and error. And then all of a sudden you blink and 3 years, 4 years, 5 years has passed and you're like, oh crap.
No,
We should have had another one.
No, I've had the conversation with people over the years, with women I've known over the years who specifically said, like, and they had the help, they had everything. It was just like I was dealing with postpartum. It took me 5 years, 6 years to be able to have another child. That's why I'm wondering, what is that
That's
category?
interesting. Honestly, I haven't seen that.
Really?
Yeah, it's very, very interesting. Usually within about 2 years, a year or two, they'll have another one. And I've even asked them, I said, oh my God, you went through so much with the first one. They're like, yeah, I know. Now I know what to expect. And then they'll have the second one, and sometimes they don't get it as bad. So it's very interesting how it can.
Is it because of all the obviously the body's in shock, right? When a woman is going through the pregnancy and then giving birth, all the hormonal functions are all over the place. Is that what causes that, or?
So causing the depression and anxiety, I mean, there's a lot of things that can cause that. Yes, after you have a child, your hormonal imbalance, 1. 2 is your body changes. So that affects you psychologically, of course. 3, there's a loss of identity at times with moms. This actually happens with dads too. Nobody really talks about postpartum for fathers. You guys also have an identity shift. And I know a lot of times when I talk about it, people will kind of like laugh or giggle about it, but it's a real thing because you have it in your own way. Now, are hormones shifting in your body? No, they're not. But psychologically, the attachment that you had to your wife is not the same. And physically, it's not the same. So that can affect you in a different way. And also the shift, as I said, just your identity is changing to becoming a parent. So all of that combined into life and how much support you have or you don't can definitely impact how much of the depression can evolve or the anxiety. Sometimes people have a lot of support. They have everything they need. It's just the chemical imbalance that happens, the hormonal shifts, lack of sleep.
Oh, yeah.
Number 1, if you're not sleeping, you're not healing. If you're not sleeping, you're not able to function. It can all really contribute to your symptoms becoming worse. And of course, not going to therapy when you need.
Yeah. I mean, you could just imagine a regular person day to day, you get 2 or 3 hours of sleep, try to function the next day. It's practically impossible.
Yeah. Now imagine sleeping and waking up every 2 hours to feed your baby or change, or having severe anxiety and not sleeping because you're afraid that maybe something will happen to your baby, because there's also SIDS that can happen, sudden infant death syndrome.
Yeah.
So there's so much that goes on in the mom's mind, and all of that can contribute to the depression and anxiety getting worse.
As far as the psychosis is concerned, postpartum psychosis, can you elaborate a little bit on that? Because look, we've talked to individuals who've gone through like post-traumatic stress disorder from wars, drug overdose recovery patients, and they talk about what happens to their psyche and their mind. And but as far as postpartum psychosis is concerned, I know you said it's the rarest one, right? I don't know percentage-wise how rare it is, but what exactly happens to an individual when it comes to that?
Yeah, so I've had a lot of cases with moms. Most of them were diagnosed with bipolar disorder, however, and they had psychotic features. So after they had a baby, the trauma of the baby, because your body goes through trauma, basically you're pushing a human being out of it. And the changes in your hormones and the chemicals in your brain, it would trigger their psychosis.
So wait, they were diagnosed with bipolarism prior to having a baby?
Correct.
Holy shit. Okay.
It's bipolar disorder.
Okay. Sorry.
It's bipolar.
Sorry. Was that what it's called? Bipolarism?
No, it's bipolar disorder.
Okay, I'm sorry.
Yeah,
it's okay.
In Marvel
and there's
movies.
2 types, but
Marvel movies.
So
I'm gonna look that shit up right now.
No, it's definitely not bipolarism, I promise.
It's a good thing we have Google. He's gonna Google it now.
Continue.
No, I want you to go. Now it's my turn, so you could just.
I'm not questioning you.
Can I poke fun at him? 30 more seconds.
Yeah, sure, no, Feel free.
I'm kidding.
You're right. It is bipolar. Oh, hold on. Marie Webster says there is bipolarism.
No.
Webster.
Yeah, but it is bipolar disorder. Yeah, sorry.
So the medical terminology is bipolar disorder. You can call it isms.
Mhm.
It's totally
Often referred as bipolarism. Continue.
So when we look at the research and when we look at patients, we want to listen. Every patient is very different. It's called postpartum psychosis because prior to their postpartum, none of these symptoms were prevalent in their life. Okay. So what seemed to have triggered it was the postpartum, them having a baby. That's why it's called postpartum psychosis. When you have any kind of psychosis, it could be triggered by medication, drugs, trauma, having a baby. You are out of touch of your reality. So you are not in control of your reality. So a lot of people might say, well, you still know what you're doing. You don't.
Yeah.
And it's a serious medical emergency when somebody is in a psychotic state.
I don't remember which. I know, for example, with bipolar or bipolarism, as
You're about to say it.
Dr. Arno would like to refer
You were
to it
about
as,
to say it. Go ahead.
or even schizophrenia, right?
Yes.
Or schizophrenism. Is that how it's
No, schizophrenia disorder.
Definitely not.
Okay.
Schizophrenia.
Listen, man, I Googled it. It's there. Go ahead. Continue.
Okay. With those types of patients, what happens is, for instance, because anytime if you interview somebody who's attempted to do something to cause harm, whether it's to themselves or family members,
Mhm.
typically what they will say is, and again, you tell me if you've experienced this or not, that there was somebody forcing them to do it, which could be, and this is, I'll give you an example of what somebody told me years ago, is they named this one political figure and they said that person is sitting there right now and is telling me, I need to go do this to my family.
Mhm.
If I don't do it, he's going to do it.
Yeah.
Or he's going to do something else if I don't do this. These are stories that I've heard over the years.
Yeah, that's schizophrenia. There's paranoid schizophrenic.
Mhm.
There's schizophrenia. That is slightly different than
Yeah.
having a psychotic break. So with schizophrenia, that's genetic. That is across your lifespan. It starts about at the age of 17. You'll start to have symptoms. Males have symptoms sooner than females, but there's hallucinations and delusions and paranoia that attribute to that. So, but when you have a psychotic break or some sort of psychosis, that doesn't mean you have schizophrenia. Schizophrenia is it's a lifelong disorder, whereas you can have a psychotic break one time in your life and then never have it ever again.
So if somebody does have that psychosis
Mhm.
and they do attempt or end up hurting their loved ones and themselves,
Mhm.
that's typically not due to the fact that they were being told by a voice or somebody. It's
It
not,
definitely
right?
can be. Yeah, absolutely.
It's not they themselves thinking, oh, I just need to, get rid of these people, or I need to get rid of myself, right? It's more,
No.
it's,
Typically, when we speak to schizophrenic patients and when we're doing therapy with them, first of all, it's very important for them to be medicated. So medication management is very, very important in conjunction to therapy. Why? Because it reduces their delusions and hallucinations. If they're having that constantly, then we can't do therapy with them. But you have to understand that is their reality. So we see this cup on the table.
mhm.
Now imagine if I told you that doesn't exist, but to you, it does exist. It's the same exact thing. To them, it exists. To them, that is their reality. So testing their reality, telling them they're crazy, it's not going to help them.
I think it's going to trigger them more.
It may, but a lot of people who are hallucinating don't know they're hallucinating. When you're, quote, I'm going to use this word very lightly, crazy, you don't know you're crazy because that is your reality. But again, that's very different than a psychotic break or psychosis. Not very different, but it's not a lifelong.
Yeah. I just don't think our community, I mean, they've evolved quite a bit over the last decade or so, but they still don't understand mental illness. They think it's a it's a choice. Where I've seen so many people, the families dealing with mental illness, and then people will be like, like gather yourself. Like,
Yeah.
that didn't cross my mind. I should gather myself and, come out of this thing. Like, no, that's not how it works. I mean, there are people who I think may necessarily not even have depression or anything, but they're just anxious about everything. They're overthinkers, and every little thing is a big deal to them. So they live their life a little differently, where every small thing they make it into, oh my God, the other day this happened. Like, okay, it happens to everybody. Like, relax. Go, like I always say on the show, go to a children's hospital, see what people are really fighting for. What your water bill was $37 more. You're going crazy over it, and this is so.
Yeah.
But it's just our community. I still think, that people are looked down upon, like, oh, what, you can't get your life together? No, it's not. It's not a choice, And I mean, I don't know if when your patients come to you, are their family members, their friends, their community understanding of what they're dealing with, or are most people trying to hide it just because they know? They're like, oh, it's kind of, there's a stigma about, oh, you're crazy, you're this.
So interestingly enough, we work with a lot of Armenian patients, which is such a beautiful thing, because we also have been able to bring in, not when the first person comes in, then we're able to bring in their partner or family member. Some family members are understanding, some aren't. And I can't tell you women are more understanding and men aren't, or vice versa. But the thing about Armenians that I've learned is that we're very resilient people, and we're very proud, which is a beautiful thing, because we really want to give ourselves a chance to overcome the struggles in our life. However, that being said, because we're so proud, we don't want to ask for help. And that is one of the things that I see with moms that I work with, is that most of the anxiety they get is because they're afraid of asking for help, because this is a common theme that comes up in therapy. They are told that, well, I did it. Why can't you? Stop. Everything's going to be okay. You're complaining too much. Why isn't the house clean? Why isn't the food there? Well, you're home all day. What are you doing all day at home? I'm going to work, or the in-laws come and they start scoping out if the place looks nice, or is it up to their par? And the women, I'm speaking for the women's side right now, the moms specifically, they feel like there is a standard that they are held at, and they need to keep that standard there, because they compare themselves to their mother-in-law or their own mother and so forth, or other moms on Instagram that just pretend like they have it so perfect. They're going to Pilates and they're having matcha and walking their children with their little, perfect yoga. Nobody looks like that as a mother. And if you do, that's fantastic. I'm so proud and I'm so happy for you. But that is not reality. And social media has really amplified the delusion of what it takes to be a mother.
Oh, yeah. We've seen it all over social media, especially the ones that have that camera set up in the middle of the night, waking up, feeding the baby, going back to bed.
Everything is a show.
It's a show. If you really think that there's a camera set up, like running 24 hours, and she's sleeping while you have a bunch of lights on, you are crazy. And again, I use that term.
Full-blown makeup.
Yeah, and I use that term very lightly, as the doctor said. But it's a show. It's literally a show. The husband's sleeping next to her. She wakes up. And the time stamp is there. Feeds the baby, puts the baby down, burps them, goes back to bed. Wakes up 2 hours. Yeah, wakes up 2 hours later. I'd say, come on, listen.
The baby's the one editing all that.
Oh yeah. Absolutely. If you believe that stuff, you got to kind of take a couple steps back and be like, all right, you know what? Maybe these quote unquote influencers are really getting to your head.
I'll give you a different maybe angle to look at it from is, if you're a newborn mom to a newborn baby, or even a dad, but especially a mom, if you don't smell like vomit and poop and milk, you're probably doing something wrong.
Okay.
No.
Look, yeah, trust me.
It's a little extreme.
No.
Right.
I'm not saying you have to walk around smelling like crap.
You're right.
But it's like, You can't be that well put together. That means you have 14 nannies or something going on, or
I think what you're trying to say that it's very normal to not be so put together as
Absolutely.
a mother, because naturally you're not going to have everything perfect on you, and because babies are very unpredictable and vomiting and pooping and all that stuff. But when it comes to, let's go back to, for instance, our community specifically, there are people who understand, there are people who don't. I would say it's 50-50. I don't know, maybe because we've come further, in our culture and understanding how important, sadly, stuff like this happens, recently with whatever happened. And it really puts things into perspective as to how much we don't know what the person in front of us is going through.
Absolutely. And that's the thing. The only thing you can't even judge your own situation at times. So you have to stop looking at, just look within yourself. What are you doing within your own family? I mean, and it varies from child to child too. For example, like our firstborn, my older son, my wife nursed him for, I don't know, about maybe 14, 15, 16 months, whatever. It was a little over a year. Our younger son nursed for almost 3 years, right? So what am I supposed to do? Tell no, you stop nursing. I need you to get back into your Pilates or all this bullshit because I need to post some videos of you on it. Like, come on. I mean, what's more important in this world than being a mother?
Correct. However, I mean, a mother also, unfortunately, a lot of things change in a mother, including her body and the connection with her husband. So there's a lot that is placed on mom. And especially the times we live in, we expect moms to bounce back like that. And that's not reality.
Yeah.
You have to allow your body to heal. You have to allow your mind to heal. It's okay if things are a little bit falling apart in the beginning. Get the help, ask for support. But there's a lot that contributes to a mother staying in her depression and it really getting worse. And the family is probably the closest thing to that.
When people say, yeah, of course things change because now you have kids, you can't be as open as you'd like, as open as you were before.
Mm-hmm.
But then the beauty of all that is that, I mean, I'm sure you would probably agree with this, is when you become parents, I think from both perspectives, from a woman and a man's point of view, is you kind of re-fall in love with your partner, your wife or husband, because now you see that other side of them as a mother, as a father. And that's sexier than being single. Okay, anybody can pull off being single.
Mm-hmm.
What do you like? It's not that challenging, but to be a mother and a good father, that's sexy. That takes a lot of hard work. So I think when you see that, the attraction changes. It even increases. What are you? Why do you have that smirk on my?
No. I was gonna say, that's when you call him a MILF.
Jesus Christ, that's what you came up with.
Yeah, I mean, we're the wise nuts for a reason.
So right now, you guys are both in psychosis. You're delusional because that's not what happens in most families. Like, you know why I'm saying delusional, out of touch with reality? So most parents, guys,
it's cute how you say that to two married fathers of two kids.
What I'm saying is that's not
it's delusional.
that is not the reality for most parents. When you have a child, it would be beautiful to fall back in love with your partner. And when I heard that, actually, I think that's amazing that you even said that, because I've never actually heard that from any parent.
Sounds gay, huh?
No, it doesn't sound gay. It's wonderful that you can fall back in love with your wife after her having a child.
That's not to say you're out of love with them. It's a different level.
It's a different level. Yes. Yeah. However, now when we look at most parents, they're not refalling in love with each other. It's actually more of a disconnect that happens. And they're not having sex, and they're not having dinner together, and they're not sleeping in the same bed. Most parents don't sleep in the same bed because.
But whose fault is that?
Well, it's no one's fault. It's just it depends on the baby's temperament. It depends on what kind of baby you have. How if maybe they're crying a little bit
Colic.
more. So it just really depends a lot on the situation that you're in. So we can't blame the parents. We can't tell a mother, no, you have to sleep next to your husband while you're super anxious about what might happen to your baby a door down.
But as far as, okay, sleeping aside, but as far as making time for each other, I think that's very important. And I think there's a massive disconnect there amongst mothers and fathers or husbands and wives, where they completely forget about who their significant other is. Look, we have family members who have had children recently as well, and we do gatherings, and they're there for an hour and a half. Well, we got to go because the baby's got to sleep, and we got to do this, and I have work in the morning, and then she has work in the morning, and we got to go with this. It's like, listen, calm down. We all have had children. Make time for yourselves as well. The kid is old enough where you can leave him with grandma and grandpa for about a couple of hours and go have a date night together.
Okay.
Go enjoy each other, but they won't.
But did you see exactly like what you just said right now?
What?
Like, calm down. Everything's going to be okay.
Mhm.
You like everything that you said is what is actually being told to moms, which is creating more anxiety.
God.
You can't tell someone, okay, the first, just a general rule of thumb, if someone is super anxious, the last thing you want to tell them, especially a woman, is to calm down.
So what do police officers say?
Like, just don't.
Ma'am, I need you to go.
Let's not do that.
Put your hands up.
It's sir, it's not ma'am. Jeez.
Well,
Shots fired. Shots fired.
so let's look at this, guys.
Go.
Yes, it's easy. And maybe for you, parenting was very different. Not maybe. For you, parenting was different than it was for you, than it was for you. Everybody has a different experience.
It's never perfect.
We're not expecting perfect.
Yeah,
though.
yeah. But that's the big misconception. Everybody thinks it's perfect, but we've had our ups, we've had our downs, we've had our hurdles with both kids. I mean, my daughter, angel. My son, on the other hand, when it came to like sleeping at night, he was an angel when it came to sleeping at night. But as soon as he woke up, it constant like, okay, Alec, don't touch this, don't touch that. Stop this.
One of these days he's gonna watch
Oh,
this.
he's gonna watch it, bro. He's gonna watch it. I mean, you guys have seen him. His personality. As soon as he figured out he could jump from that couch and hit the floor with his 2 feet, that was it. Whereas again, it all depends on the kid, and it depends on how you're going to juggle the kid. But look, it's a two-way street. It has to happen. Husband and wife have to juggle the kids together. They have to.
I think they're spending too much time. Couples these days, like, oh, we're gonna read this book, and then we're gonna read that book, and just look. If animals in nature know what they need to do, right? You see lions, you see wolves, you see dolphins, orcas. I love the Animal Planet. You guys can tell. Naturally, they know what to do. How to, feed, how to protect, how to hunt. So we have those natural instincts too. Yes, I know not everybody's instincts are some, they haven't paid too much attention to their instincts. So it's kind of, but I think there's too much. It's like, I read this book and they said, I need to put my baby down to sleep no, sweetheart, you don't need to do that. I remember when we were young kids in Armenia.
Sleep training, right?
Everything is training. We were little kids in Armenia. My dad would come home from work. Let's say 7:30, right? My brother and I were young, like maybe 3 and 1. So in Armenia, used to, especially my dad was, okay, let's go somewhere. So my brother and I are sleeping. So he would just pick both of us up while we're sleeping. And there was no, we're going to call. So we would just walk from Abovyan to, whatever part of town. You go to your aunt's house, your cousin's house, and while you're sleeping on your dad's shoulder, and they would put you down in the bed and you would sleep till 11 o'clock, and then they'd pick you back up. We did fine. But now it's like, no, Timmy's got to be in his bed listening to Ludovico Eunadi.
Mozart.
She knows who.
Or Mozart. Could have got Mozart.
But
Mozart's good for your brain.
You gotta start Mozart when she's pregnant, so that the kid
baby Mozart.
So but I don't know. I just think we're putting too much emphasis on trying to be these perfect, ideal parents when just be natural. Just go with your instinct and don't focus so much on timetables and did we feed Timmy, 40 ounces of grams of protein and carbs, and like Timmy's not training for the Olympics.
The best is when they overfeed him and the kid throws up. Like, why did he throw up? Is there something wrong with him? Is he sick? Yeah.
Well, I mean, when you look at it in what studies show, every human being needs to have some sort of a structured schedule, because that's what gives you a rhythm. That schedule can change. You don't have to be rigid, no OCD about it. But having a schedule is important. Now, why do moms become so obsessive about the schedule? Is because it's finally something that they have control over.
Yeah, but it takes away from you.
I get it, but that's actually something that helps them in a way. So if they know that, okay, so, he goes to sleep at this time, then she knows, okay, then I can take a shower during that time, or I can eat during that time. Usually, doctors will say, when your baby sleeps, you sleep. That rarely ever happens, because the poor mother, when the baby is sleeping, she has 12 other things she needs to do in the house. So having a rhythm and having some sort of structure, there's nothing wrong with that. I do agree with you. There's too much information out there, and becoming super rigid with your schedule is what feeds your anxiety. But let's go back to the mental health part of it, which is important. We have been raised very different than the way our generation is raising their children. I don't have children, but I see the way our generation is raising their children is very different than the way we have been raised. Can we all agree on that?
Absolutely.
Yes, absolutely agree.
Definitely.
So that being said, I think a lot of times I see patients throughout our generation, they're trying to give their children what they never had, which is just different type of parenting.
Horrible parenting?
I don't know about horrible. I'm not a fan about the whole gentle parenting situation, because
What's gentle parenting?
Stand in the corner.
no, that's not even gentle.
Don't do that again, Timmy.
Yeah. It's like, well, how did it make you feel hitting your friend Johnny?
Oh, that
Don't
type.
do that.
Oh, that's the worst.
That's not parenting.
It's funny. I saw this clip a couple of days ago on Instagram. It was some lady saying, ask these 7 questions. So I'm like, let me test it out with my kids.
No, man.
I swear. So I did it. I went the other day. We were at the beach.
Noah looked at you.
Yeah,
This guy a retard.
I swear. So one of the questions was, do you think I spend enough time with you? The other one was, do I try to understand you or just correct you? And then it's like 7 more. So I'm like, I started with one of them. I said, do you think I spend enough time with you? He's like, yeah, Papa, of course. I said, no, like, think about it. Do I? He's like, yeah, you spend time with me. Yeah. So would you like me to spend more time with you? Like, I'm like, maybe I'm asking it the wrong. And then I asked him the second one about, what was it?
That's a good question, though. I'm not too against that one. What's the next one?
I think the other one I asked is,
Wait, can you go down the list? I'm curious.
You want?
Yeah,
okay, so let's do. Okay, so number 1 is, do you think I spend enough time with you?
Okay.
This can show hidden feelings of disconnection or loneliness. Number 2, do I try to understand you or just correct you? This reveals whether they feel guided or constantly criticized. Number 3, do you ever feel like I compare you to others? This can uncover pressure, insecurity, feelings of inadequacy. Number 4, when I say no, do you still feel safe with me? This shows whether boundaries still feel loving and secure.
That would not fly in my family.
Number
My
5.
grandma would be like, I don't care if you don't feel safe with me.
Number 5
As
is,
you should.
when you make mistakes, do you feel safe coming to me? This shows whether your child connects mistakes with shame or support.
Okay, but how old is the child that you're asking these questions to?
I asked it to my almost 8-year-old son, and then to my 6.5-year-old son.
Okay.
Yeah.
What were they saying? Like, how old should the child be? Because these are very, like,
It didn't say anything
deep
about an age.
questions.
And then number 6 was, what's something I do that hurts your feelings?
Oh.
This uncovers small wounds we may not realize we're causing. And then number 7, the final one, is, what's one thing you wish I noticed more about you? This can reveal unseen emotions, efforts, or struggles.
Okay.
I think the first 3 were like okay. After
Yeah.
that, it was kind of like
I mean, I don't see it as a negative thing. You're
Yeah, it's
still, as
not.
long as you're communicating with your child, right?
I mean, I think as long as your child is able to comprehend what you're trying to ask them, because I have a feeling most kids will kind of look at you like, why are you asking me this?
yeah, exactly.
Which is what they did, kind of. They're like, no, Papa, you're doing fine. Like,
Yeah.
don't worry.
It's like, Dad, keep your eyes on the road.
Armenian kid, you're asking.
That is such a good point that you just brought up. Just for all parents out there, you're doing a better job than you think you're doing.
Yeah.
And this is most of the time. Most of the time, the parents are more hard on themselves than anything because they want to do the best. They don't want to damage and traumatize their child. That being said, a little bit of trauma is okay. We've all had it.
We all had it.
It teaches you how to be resilient. I'm not saying like severe trauma. A little bit of you being compared to other people is totally fine. That teaches you to compete. You have to compete. It's okay to look at somebody and go, okay, how did they get there? I want to be there. You're comparing where are you, where are they? And then you figure out how you become a better version of yourself. So if you're not comparing yourself and you're just like, I'm fine the way I am and there's nobody better than me, and you're not really reflecting on who you are and how you better yourself and become friends with people who are better than you and so forth, then you're not going to progress.
You're raising a narcissist at that point.
I have a good idea. We should maybe ask these questions to our producer, Joe.
What about it?
We go over the 7 questions.
The 7
What's
questions,
one thing
Joe?
you wish I noticed more about you, Joe?
Oh, my eyes. I don't know.
Like
He's like, I want to be noticed. Just fully.
a lot of these parents are just a lot of parents need to work on themselves before they attempt to work on their kids as well. Recently, I was telling Armand the story about I started taking my boy to soccer, and look, they're 4 years old. All right, so am I expecting my son to be the next Messi or Ronaldo? No, it's there for him to meet other kids, interact, play a physical sport, and enjoy himself. But some of these parents look at it like it's the freaking 2026 World Cup, and it's like, hey, tell your kid stop pushing my kid, and they go at it in front of their kids, and it's like, dude, it's like, guys, calm down. The kids are 4. It happens. But I think there's a lot of people that need to work on themselves before they attempt to even, it's going to sound harsh what I'm saying, but have kids.
But, well, yes. However, it's very hard to work on yourself when you come from a culture. And again, there's nothing wrong with our culture. The thing is, in Armenia, for instance, even nowadays, psychology is looked at very differently. There's a different perspective on it. It's more advice giving. It's more like coaching, counseling, very lighthearted.
Well, yeah, because they don't want you to think, oh my God, I'm going to see a psychologist or psychiatrist because I'm crazy.
Yeah. So that used to be the case, back in the 100 years ago. And do we have cases where, yes, we work with severe mental illness? Absolutely. However, these days, people can go to therapy for anything. I mean, you could have it there. I think everybody should have a therapist, to be quite honest, because that's that one person where you can go and they can guide you to think about your thinking and understand your internal world, pick up on your patterns, and figure out what you want to better about yourself. So that's like the lightest therapy.
But it depends, Irene. That's the one thing that, look,
It depends.
It depends on who the people are that you hang out with, what you're struggling through, if it's something that truly does need a therapist or not. Like, for example, I think a good form of therapy is just guys' night out. Guys being able to hang out with one another, bounce different ideas off of each other, shoot the shit.
Not therapy.
Of course it is.
No, it's
That's
not.
another form of therapy.
No, that is a social gathering.
But it's a form of therapy. And
if you want to look at it that way, that's fine. But
do you guys take pills?
That's
we take gummies.
So it's a different kind of therapy. However,
Does
when
it
we
work?
look at therapy, again, you always have to remember, you go to therapy when you start to experience things, whether it's the way you're thinking or how you're feeling, it starts to affect your life.
What is
Social,
what is the definition of therapy? Does it necessarily mean you have to see a specialist for therapy?
Well, yeah, you need to be a licensed therapist.
No, but I mean, you can't. No, I'm dead serious, bro.
What do you mean
You're
specialist
laughing.
for therapy?
What you don't think hanging out with friends and shooting the shit together and
that's unwinding.
So
that's
you
what,
want to
man.
look at it.
That's you know what I look at it. I look at that as a form of
Okay,
therapy.
That's fine. That's wonderful because what you're okay. So I'm going to ask you this: what do you consider therapy to be like?
What do I consider therapy to be like?
So meaning
therapy
not
could,
with your friends, meaning like how does it feel when you're in therapy?
therapy could be you being able to comfortably
Talk
open
about
up.
yourself. Not
Yes.
me. You.
Yes.
I.
Should we later?
Do it.
No.
Take your shoes off.
in my opinion, therapy is being able to openly, comfortably being able to express any feelings that you have,
Okay.
whether it's with your wife, your friends, somebody who understands you and can relate to it and can bounce different ideas off of you.
Okay. So that's not therapy.
So what is it then?
You're not going to bounce ideas off your therapist. That is a life coach.
All right.
That's why we go to school and we get board licensing so we can actually do therapy. Your therapist, that's amazing that you have people that you can do that with. By the way, a lot of people don't have that support network. So that's life coaching.
Okay.
Therapy
But then you could hire a life coach as well, just to heads up.
I would not ever hire a life coach. I'm sorry, but yeah, no. Why would you do
Hold
that?
on. So may I intervene here? So what you're telling me is, you know, I have a guys thing every Wednesday night. I've had it for.
That's not therapeutical?
That's what what I'm saying. It's therapeutic as a man. It's like therapy. We call it therapy because men need men time, alone time.
Okay, but does it not help kind of unwind you and help you
it's
help you
unwinding.
throughout the week? And it's something where you were to sit down with possibly a professional where you're like, you know what, I feel better for that.
But Wednesday night, for example, let's say if I'm having an issue at home, I'm not going to sit down and say, you know, the other day my wife and I, we had an argument about this, because you're not going to have that discussion.
That's not a discussion you have at that place, though.
So that's not therapy.
That's
Because in therapy, you could talk about
therapy
anything.
is that. Therapy is you talking about things with somebody you have no relationship with other than a professional relationship. And that's one of the reasons why if most doctors, but especially psychologists, will never, and I've a lot of them have mentioned this to me, because they're like, we'll go to a wedding and then, you know, some people will be like, hey, how come you didn't say hi to me? He's like, well, I can't say hi to you because they're going to think you're my patient. So they're going to think you're in therapy with me. So if you come and say hi to me, I'll say hi, very general, not like, oh yeah, I know you.
Yes.
Because of that, because it's a private conversation, right? I mean, correct me if I'm wrong. So it's a little different.
So what you guys are talking about is something being therapeutic versus therapy.
Yeah.
Okay.
All right.
So you having a guys' night is therapeutic. It makes you feel good. You feel connected. You can talk about things, bounce ideas off of one another, blah, blah, blah. In therapy, again, you need to have some sort of symptomology. Therapy, psychotherapy, there's different types of therapy. Psychotherapy is in the medical field. So when you come to a therapist and you sit down, your very first session is going to be your psychiatric evaluation. That consists of your biopsychosocial. So we assess you. We ask you like 1 billion questions about your biology, like things that you're going through, maybe medically that you have, any kind of medical conditions, any kind of psychological issues that you ever had, or your family has ever had, how you're doing socially, how everything that you're going through is affecting you socially and occupationally, your mental status, there's so much that we have to assess in that session to then come up with a conceptualization of why you're going through what you're going through, and then to create a treatment plan. So there's so much more that goes in therapy.
So
than
okay,
just
have you ever had a patient where they've come in there and you've quote unquote diagnosed them and you've been like, okay, you know what, you don't need therapy. You're fine. Or has every patient that's come in and you've asked them these a bajillion questions and they've been like, all right, you know what? No, we need to work on you. See, that's
I have, however.
This is why I was saying it was to the extent.
No, there's a difference. Most people, 99.9% of people, they minimize their symptoms when they come to the first session, especially if you are a male. They don't tell you everything. We give them a PCL, which is trauma assessment, or a GAD, which is their anxiety assessment, to gauge where they're at, and they score 0.
What's a PCL?
A PCL is, I'm sorry.
You're okay.
It's time to give the medication to my dog.
Well, your dog's not here, so I hope someone's giving the medication.
We have a limited time, so
they're on a schedule, right?
I hope it's not insulin.
So the PCL, we go ahead and give somebody who's dealt with any kind of trauma a PCL. It gauges where their baseline of traumas. A GAD is for their anxiety, PHQ-9, and then there's the PHQ 15. So there's the physical symptomology that happens, and then the PHQ 9 is for depression. So when you come in, we are assessing you. That is the first thing we do. When somebody scores 0, I will sit with that patient and say, looks like you didn't read your assessment. And they're like, yeah, I just said 0 to everything. I said, okay, so we're going to redo it. Because when you're here, we're looking at you from a medical perspective. I need to actually know what's happening so that I can help you. Most of the time, they'll minimize it. And then we'll sit down and we'll say, okay, so this is what's happening. And I'll go ahead. If I feel like, oh, they're not really in need of too much therapy, I'll give them a time limit. I'll say, let's go ahead and meet for 5 sessions and let's go from there. So it allows me to give myself sufficient amount of time to continue to assess them in their next future sessions, and guarantee by the second or third session, they're already opening up about all their trauma and this, and their overthinking and their family issues. Why? Because you're of course not going to sit there and tell that person everything about you the first session. And that's why they complete an assessment, they complete a questionnaire, then they do another assessment with us. So there's so much more to therapy.
I was about to ask, how long does it take for them to actually open up?
It depends on the patient, but most of the time, at least in my experience, it's like by the third session, they're fully committed. They're like, oh my God, I've said things I never even thought I would say. I'm like, that's good. That means you feel safe here. And that means you're allowing yourself to kind of spew out that poison that you've been holding on to for so long, because you finally feel like you can talk about it and know it's going to be here. It's not going anywhere. And I'm also not judging you personally. I'm clinically judging you, which means the only thing I would be asking is, okay, hold on, is this person safe? So with psychosis, with somebody who, let's say, has psychosis or schizophrenia, bipolar disorder, any of that, or severely depressed, one thing that we're constantly assessing is, are they safe to themselves or other people?
We have a question regarding that as well.
Yes.
So how effective does she think EPDS scale questionnaire is to catch these things?
EPDS is Edinburgh.
It's the Edinburgh postnatal scale. Okay. So effective wise, so it's just, again, this is a very short assessment that we give mothers who have just had a child so that we can gauge on their baseline of how their depressive symptoms are affecting their life. So effective, there's no efficacy on that. It's just giving us, your therapist, an understanding of where your depression is. In addition to this, you'd probably most likely also complete a GAD, which is the Generalized Anxiety Disorder Assessment.
There are doctors or psychiatrists or psychologists that do see the mother and do those questionnaires prior to them being discharged, right?
Not many, but they should. But they're not trained in it. You have to understand, just because you're an MD doesn't mean you get training in every single thing. That's why there's a gynecologist. That's why there's a pediatrician. A
specialist for everything,
Yeah. So the good doctors, which I appreciate them so much, is that once they see even the slightest, symptomology of depression or anxiety, they don't wait for it to get bad. They refer them out to a therapist, and they encourage the mother and the father, go get some help. You don't have to be in therapy forever, but we don't want your symptoms to get so bad that it turns from baby blues to full-blown postpartum depression. That's what we're trying to avoid when you come to therapy.
Yeah,
is symptomology control.
We had another question earlier. Sure. If someone sees people there that aren't, should you just act like they are there, or keep telling them there is no one there? Like, is one more beneficial versus the other?
So I would avoid questioning someone's reality if you're not a therapist, because you don't know how that person might react. When there's any kind of psychosis involved, the predictability of how that patient is going to behave it's very unpredictable. It's slim to none. So I wouldn't say, oh, that's not there. I would convince them to go to therapy.
Yeah, if somebody's seeing things, then you tell them, okay, maybe you should.
Yeah, you would want to sit down very, very kindly and have a conversation with them and just try to understand what they're seeing and stuff. And then just encourage them to understand that, well, I'm not seeing those things. I think you might want to talk to somebody and move from there. You got to let us do our job. We can challenge them because I know how to deal with somebody who I'm challenging, so that I can help them kind of break through that unrealistic delusion they're in.
Well, what about the people that see, again, this is a true story, by the way. I know individuals who have seen family members who have passed.
Oh, like
And
right after they passed?
Yeah, and then but they acknowledge that I know they're gone,
Yeah, that's
but
very
I
common.
saw them.
That's common after somebody passes.
So
Very common.
Very
Yeah.
okay.
When my grandma passed away, I called her number because I was in denial. I called her number and I heard her pick up the phone. I swear to God, today. I also saw her in my kitchen. I swear to God, till
Have you
today.
thought about seeing a therapist?
I have a therapist. Thank you very much. But
Okay.
that is actually very common right after someone passes, and then it just passes.
So
It
that's
goes away.
normal.
Very normal.
What do they
Especially
call
in other
that?
cultures, like in the Mexican culture, that's very prominent. In the Armenian culture, so that happens. But it happens to any human. But we're more because also we're very hardcore believers as well.
Yeah.
But that's very common for. But that
Okay.
doesn't mean you have schizophrenia.
Is there a name
There's
for
so
that?
many
Is there a
other-
name for that?
You know, I don't know the name actually. We could look it up on Google, maybe.
Okay, yeah, can you Google it, Joe? Just look it up really quickly.
Dr. Google.
Yeah, because there was, they acknowledged it. They
Yeah.
knew that. Look, I know Grandpa's gone.
Yeah.
Uh,
That's not psychosis.
it's not. It's not. All right.
Psychosis would be, yeah, grandpa's right there. What are you talking about? And they like right there. They're out of touch of
Oh,
reality.
so they believe that he's not gone.
That is their reality. When you're schizophrenic, that is your reality.
Because look, there are certain drugs that take you to a psychedelic or psychosis state.
Yes.
Certain pH.
but that is induced
THC.
psychosis.
Yes, certain THC. Is it the same chemical kind of imbalance that takes place in your brain that does that? Or what is it exactly that happens that you begin to see these things? That's what I'm trying to like wrap my head around.
Well, we can't. Well, that's what I said. That's substance-induced psychosis. It's very different. That's not an organic psychosis that happens. Organic is when you're not using substances. That's just your brain functions that way.
Like, would you see these? I don't know whether it's neural waves or whatever it is inside the brain during like an MRI or something.
Yeah, an EEG as well.
I'm curious if they've ever done that with psychedelics and with somebody who possibly has.
I believe they have actually.
And I wonder what the
Yeah.
wave differences are.
Oh, well, when you look at a brain of a patient who has schizophrenia, so you know how, I don't know how to describe this, but there's like the gray matter.
Mm-hmm.
Okay, so the distance between the gray matter
Is
is
it's
larger.
It's larger, basically.
Mm-hmm.
See, that's what
You
I
know what? It's either larger or skinnier, but I know there is that difference. Don't quote me on that.
There was a clinic who did a lot of studies on that.
Yeah.
I forget the name of the clinic.
There's definitely a change in the brain when you look at it. But now let's look at, you had said one other thing.
The
before
grieving
that.
one, by the way, is bereavement hallucinations.
There we go.
PBHE.
And bereavement is a fancy word for dealing with loss, somebody passing.
I know, because there's multiple stages of grieving when it comes to people
First
passing.
one
And
is
denial.
But there's even, I believe there's a stage before denial, which you're not even in denial. You're just nothing.
Shock?
Yes.
I mean, there's denial, there's anger, there's sadness. I mean, there's so much.
Yeah. Our grief group is probably one of the most, next to our postpartum group and trauma, it's one of the most popular groups. And the magic that happens in our grief group with patients who have lost individuals is amazing. And that's why group work is so important, because people connect and they don't feel crazy. They don't feel like they're the only ones going through this.
I think that's what really takes people down. Kind of the black hole is when they think I'm the only one in this world dealing with this. That's why, as you mentioned, even if you're dealing with something, you don't want to go to group therapy, or you don't want to go join one of these organizations where they, it's kind of like an AA, but there's groups for Alzheimer's, cancer, grief, everything, heart disease.
Group therapy. You're right.
If you can even just go volunteer at somewhere, the fact that you're helping somebody else out is going to give you purpose, and it's going to take you away from your own thinking. I'm the only person in this world that's ever lost a grandmother or father or whatever the situation is, because people I mean, right now, as you guys just heard that tone, right? Everybody deals with situations differently. So that priority alarming message that came is a patient who has Oh, sorry. A little black mark right here just now. I don't know if it's a bruise, what happened. But the caregiver family's panicking like, yeah, you need to send a nurse. You need, like, dude, it's just like a little scar, or not even a scar. It's a, what do you call it? Like a little bruise. Just, you don't have any bruises yourself? You've never had a bruise? Oh, we need to go to ER, call 9. My point is everybody handles situations a little differently, you know? And some families think everything is end of the world. And some families, no matter, I could, like,
Just send them a picture of a cauliflower ear. Like, it could be worse.
Why are you holding your headphone like
It fell off. It fell
Biggie
off.
Smalls?
He's rapping now. Look, Eminem.
I'm trying to be.
He's about to MC.
At what point do you take that into family member to an ER? Because there was a question about, so one person said, well, at that point, take them to the ER. But
What point? If they're seeing things?
yeah. Like,
Yes, when they become a threat to themselves or someone else is when you can 5150 them.
Yeah.
Or take them to an ER. And if you call the police, they should, if they assess and if the police officer knows how to appropriately assess, hopefully, then they will take them in and put them on a 72-hour hold.
Doesn't calling the police accelerate the situation a little bit? Put the person in more danger?
How so?
Let's say they did something at that spur of the moment and the cops saw it and they shot him.
No.
Oh, geez, that's extreme.
When you call, you
that's-
explain the situation.
Yeah.
You don't just say, hey, there's somebody here acting weird.
He's got a gun.
Yeah,
mean-
we don't want to do that.
Loaded.
I think we went from one extreme to the other. So,
Yeah, extreme.
so luckily enough,
What if they've got a bomb strapped to them?
no. So luckily enough, these days, cops are actually well more versed in the psychiatric field, thank God, and how to approach a person who's going through a psychiatric mental breakdown or whatever issue, how to speak to them, how to assess them.
And they have
That's really important.
non-lethal ways of
Yes.
taking
No,
them
but
down.
I know somebody whose cousin is schizophrenic.
Mhm.
He got, this is a few years back, he got fully naked, runs into his grandma's house, stabs her in the neck, doesn't fortunately kill her, but she's bleeding out. He's running across the yard. And when they called 911, they said, look, the kid's schizophrenic. You see blood. He hasn't killed. Do not come here blazing, shooting. So the bunch of cops show up, obviously. They knew the kid was schizophrenic.
Okay, but
so
let's say that guy runs with the knife to the cops. What happens?
Taser.
Are
Well,
you serious? They're
don't
going to
think-
tase him all the time?
I'm not a police officer, but I don't think they really care if you're schizophrenic or not. If you're running towards a cop with a gun or a knife, you're
Yeah,
probably
well,
gonna
no,
get
I'm
killed.
not saying the kid was running with a gun, but
Or knife?
I don't know even if that, when he,
Screwdriver?
but he stabbed his own grandmother.
Yeah, of
And
course.
the
Yeah.
cops knew that. So they knew they weren't showing up to a homicide, like crime
Right.
scene. They were showing up to a,
Yeah.
I mean, at that point, they have to call him. Right?
Yeah, so they would need to most likely, I'm not a cop, but restrain them and take them to a psych ward.
Yeah,
Yeah.
there's so many stories out there of people hallucinating, seeing things. I mean, there was that mom in, I forgot what part of Texas it was. I think it was in Houston, where she literally drowned her own children
Yeah.
because she was terrified of somebody else killing them.
Yes, that's
See,
that can-
like what
so. I
does,
had
does a husband or anything or a family member not see these signs?
sometimes they don't, and that's the sad part. Especially if that's not a common thing. In LA, everybody's like mental health, physical health. Like most people don't live the way we live in LA.
yeah.
So I had a patient. I worked with her for about 7 years. And throughout that time, she had 2 children. She was diagnosed bipolar. Prior to having her first child, she came in after she got pregnant because she was having a lot of, how can we call it? A lot of anxiety. Okay. So when she had her baby, she would hear voices that would tell her to drown her baby every time she would give bath. So what do we do in that situation, right? First things first is we need to make sure that medication management was being completed and she was compliant. Second, we made sure that child was never left alone with her.
But hold on, did she acknowledge that
Yeah.
the voice? Okay, so she
Yeah.
she
So-
was basically she was affirming that somebody in her head was saying John the baby.
So what happened was we learned this throughout a lot of her writings that she would do in therapy. First, for her to acknowledge that was a very big thing, by the way. So it came out, she didn't really just come and say, hey, I heard voices in my head and they were telling me to draw my baby. It happened through some art therapy and writing work that we were doing, where after reading it out loud, I realized that this was not her voice. This was something that was talking to her. So there's a little exercise that we do in therapy, and we have you write a letter to yourself. And that patient will sit down and write a letter to themselves. They can write the letter to themselves as a younger version of themselves or a person in the future. This patient wrote a letter to herself basically with so many demands. It didn't sound like her. It was like a third person. Literally a third person. And so when we processed it in session, I asked her, I said, whose voice is this? And she said, what do you mean? I said, whose voice is this? And how long have you been kind of talking to this voice? And I was just assessing her because it didn't sound like her. I've known her for some time. And she told me, she said, I'm having conversations with myself all the time. There's nothing wrong with it. We had to teach her that what she was thinking was not appropriate, because she was not only trying to kill her baby, but herself. Herself trying to commit suicide was the first thing that led her to psych ward. Then that's where the medication increased, the psychiatrist got more involved and so forth. And I was able to get her to not be with her child alone. Because then when she started to realize through therapy for several months, we got her to understand that this is actually not your voice. And killing your baby is not what you want to do right now. So we taught her how to therapize herself. So with her, she's a very, very interesting case, actually. And she was one of my first patients when I was an intern. And I saw her all throughout until I got licensed and everything. And one of the things that we taught her is to think about her thinking. And she learned and she realized, and I would tell her, I would say, okay, so how would you do it? And she would explain it to me. And yeah. However, she thought that that's just what she needed to do. Okay, I'm not going to get too into it. However, that was her psychosis because of her borderlineism, what you like to call it. She was diagnosed borderline personality with psychotic features. Okay. So anyways, throughout years of therapy, of us monitoring her, making sure she complies with medication, after a while, when she had her second baby, she started to check herself into the hospital when she heard her intrusive thoughts play in.
So
her being in therapy for so long she was able to distinguish reality from not.
Okay. But was she in therapy prior to getting pregnant, or?
Yeah, she came into therapy right when she got pregnant because she was having anxiety.
Okay, but was she suicidal prior to getting pregnant?
Not that I know of, because she was diagnosed with bipolar. She was on a very light dose of medication.
Is this stuff genetic? Does it pass along?
Bipolar disorder?
Yeah.
Some say yes. Some
or
say
schizophrenia.
No. Schizophrenia, definitely yes. There's almost all the research shows that yes.
It shows that it does pass along.
Yeah.
We had another question, which I think this is probably the most common question people faces or challenge is, what if that individual loved one, family, friend who is having issues, we know they need therapy or they need to be on meds, but they're in complete denial and they think everybody else around them needs a therapist. How do you persuade them, or how do you force them to go see somebody, seek help?
That's typically the patient that's going to either end up in jail or a psych ward, and that's how they go into therapy. Or they end up using drugs, they become homeless. Something leads them to a more severe situation that forces them into therapy.
But I mean, here's the issue. For example, you mentioned earlier 5150, right? That's a 72-hour hold, which isn't much.
Right now they're keeping them longer. It's actually nice.
Isn't the longer different 5250 or?
No, I mean, you can, once they get into the psych ward, the psychiatrist can assess whether they're going to be there for 72 hours or a week. Or
I see. So they actually admit them they're not just on hold. They're an admitted inpatient.
Oh, no, they're admitted.
Okay.
But,
but see, that's part of the challenge is most, if not all hospitals have 0 beds, 0 psych beds right now. Mm-hmm. Like, I can't think of a hospital in LA County that has a bed. I've tried to get Mr. Polarism here into one of them, but... No, but seriously, there's zero beds.
Yeah, I don't know why that is. Maybe that goes more into our politics, which I don't get involved with.
Thank Ronald Reagan for
it's
that.
a very sad situation because most psychiatrically ill people are on the streets.
Yeah,
sadly, self-medicating themselves is what I like to call it. And when you see somebody on a lot of drugs, typically that person has severe.
But let's say it's your cousin, your sibling, whoever. How do you're not going to say, okay, well, let's do these drugs so we could send you to jail. And then how do you get them to, because most of the time, even if you take them to the ER, they're not showing symptoms of a, 5150. Have you thought about doing, no, there's no 5150 here. You're like, no, at home, this is what they try to do.
Well, they've become a little bit more they used to be like that, where it was very hard to admit somebody, but they've become a lot more understanding to the family. And if they're a threat to themselves or a family member, they're going to most likely hold them.
But see, where do you hold these people? And for how, again, as you guys mentioned, it's a 72-hour hold, if not a little bit longer. But if these people need a therapist, they need some sort of medication to kind of mellow themselves out, and they refuse to go see a therapist or take these drugs or medications to help them come back to reality, then what?
Well, when you're on hold, they force you to take medication. You don't have a choice. And when they discharge you, you have a treatment plan where you're going to go, what therapist you're going to see. They do follow up. But when you have a good social worker, that is.
But do most insurances even cover therapy or even, let's say, psychiatrist?
Yeah, of course they do.
Do they?
Yeah.
Because from what I've noticed over the years, the majority is all, and that's part of the issue, it's cash.
No, we have a lot of insurance patients. Yeah. Really? We're in network with every insurance.
Oh, okay, maybe that's a newer thing, I guess.
Just not, never mind.
Just not what?
Just not Kaiser.
Oh,
I was going to say. I don't.
Trust me, you're not the only doctor who's complained about.
I refuse to work with them. But
you complain about that too, doctor?
No. We've had other doctors complain. I'm not a doctor.
No, insurance covers mental health. It depends on what insurance you have and what they cover and stuff like that. Actually, some insurance covers only in-person mental health and no telemedicine, which I like that because patients should be going
via Zoom?
No, like over the phone.
Oh.
Telehealth, telemedicine.
Well, telehealth is also virtual.
Yeah, it could be virtual, but you should go in and go into the room.
Yeah, your body language, everything is.
It's a more, eye contact is very important. And these days, that's something we're lacking because we are all hiding behind screens. We all prefer to have phone calls. We all text. We don't even talk to each other most of the time over the phone. We're texting and we're interpreting the text through our own perspective and perception of that person.
That's if you even get a response.
That's even if you get a response. And then when you get a response an hour later versus 3 days later versus a minute later, so it's a lot of missing information. So when you have, like right now, we're all sitting together. There isn't only the content that we're discussing, but there's an energetic field that happens between every single human being. So the way you feel around a person, how you show up, how you speak, your I don't know, your affect, your mood, everything changes when you're in front of a person.
Yeah.
So
it's funny you say that about text messages. We actually, every 4th of July, we do a gathering in my backyard, and I sent out a group text message to my family and friends, or family actually, about, who's going to be coming. I got to do like a head count for catering. Bro, it was like 3 hours, 4 hours, 5 hours. Nobody's not nobody, but like I had like a handful of people respond. Yeah. And then all of a sudden I tried something. So I texted and I put a poll in the text. So I said, hey guys, I could see that you guys opened up the poll, but you're not responding within a minute.
Yeah.
And you can't see it. I just said it just to say it. Within like a minute, everybody's like, oh, sorry, I didn't see it. Yeah, I'm coming. I was like, oh, you didn't see it, huh? So it's kind of like, I don't know.
That's exactly what I experienced recently because we're planning our big family trip to like Temecula or the desert, and same exact thing happened. Then I did a poll on WhatsApp.
And everybody opens it. I saw it. Is there something wrong with society and people not wanting to respond right away? I mean, you can't be that busy.
I think a lot of people are distracted.
Distracted by what? Social media? They'll post something on social media, but they won't respond.
No, those
to a text
types
message.
of things, I think everybody's waiting to see. Oh, I wonder, is Joe going? Is Arby going? Is Narbe going?
So then, who are you going for? Are you going for Joe and Narbe and Arby, or are you going?
Yeah, everybody's waiting. And then one
Everybody's
person will
waiting for
say,
my response,
yes,
Joe.
I'm in. And then everybody's like, oh, I'm in. You're like, what the hell, you guys? Just all of a sudden, everybody's in.
But I mean, not even an invitation, just an in general text message to somebody.
Yeah.
You'll text somebody just to say, hey, how are you? How is everything? And they'll respond to you like hours later. But they're on social media constantly.
Yeah. I'm telling you, they're distracted. They forget. People's memory does not work the same as it used to. Most people will pick up their phone to do something and then they get distracted by something else, and then a notification comes on Instagram.
Ooh, tits and ass.
Well, maybe that's for you guys. But I'm referring to emails.
The algorithm must be.
Well, we know what your algorithm is.
There you go.
You guys, we're here to talk about postpartum depression. Let's go into
And mental health.
I know, but we still have to make it fun
Yeah,
and
we do.
entertaining.
You go to you walk into the garage to grab a Diet Coke. You're like, what was I here for? Oh, yeah. Oh, I gotta get a raise. I'm sorry.
okay.
Nothing
I will
changes.
wait. It's totally fine.
I'm sure.
I gotta re-microwave this ham and cheese sandwich now.
So going back to our culture, guys,
Yes.
about what is happening. But honestly, like what has happened has definitely shooken up our entire culture.
But do you think it's only our culture that has this stigma? I think it's a lot
No.
of the Middle East, Europeans. It has a lot to do with that aggressive type of family dynamic.
Yes, because that's the way they were raised. You can't look. We can't wonder why older parents, like grandparents and stuff, they don't understand psychotherapy and therapy and mental health. It was not the norm when they were being raised. So they were doing the best that they can. They typically, a parent raises you the way they have been raised. Typically.
Yeah.
Okay. So we can't blame our grandparents and hate them for not knowing. They just didn't know. That was not their norm. It's very taboo to them. And rightfully so. Back in their days, psychotherapy was not what it was these days.
But they did have rules. They had rules not to leave the baby alone for 40 days with the mother alone,
Mm-hmm.
from what I remember. Is that accurate? Have you ever heard of that?
I don't know about not leaving the
don't
baby
know.
alone. They just didn't socialize the baby to keep it safe from.
I
But
believe that there
but I
was
really
something
like
like
that.
that, though.
I
That
really
for
like
40
that.
days, I believe there was a rule that they wouldn't allow the mother alone with the baby, only because of the psychosis situation,
So
possibility of it.
let's look at this. So how can we kind of better parenting or better relationships and better oftentimes a sentence is said in therapy, which is pretty sad. I was raised in a family where my uncle, who was like my dad growing up, he changed diapers, he cleaned, he did everything. He did a lot. He helped my aunt a lot. And that's what I've always seen. Oftentimes I hear husbands say, I'm not changing a diaper. Why not? Why not help your wife and just change a diaper if that's just something that she needs you to do?
Ego.
Okay, so how is that going to make you less of a man if you changed a diaper?
It actually makes you more of a man. I don't know.
But I'm just asking, as a man, and I'm not coming.
I
I'm not gonna
changed my
come from
baby's
a-
diapers.
Okay, I'm not going to come from a judgmental place. I'm a woman. I don't know, but please help me understand the psychology behind, the reasoning behind. I'm not changing a diaper. That's not my job.
I think typically those type of men are the ones that, listen, I go to work, I pay for the bills, everything else you do. I don't touch anything. I think that's the mentality of,
Okay,
if I provide, then I ain't touching nothing.
Yeah.
why?
I think that's the mentality.
You're right.
Do I agree
but
with it?
why?
Absolutely not.
What is
No.
what is the reasoning behind that? And as a man, I would like to understand that. Help us women understand.
I think that comes from more of that old kind of male chauvinist upbringing of, men are supposed to be tough. We don't wash dishes. We don't clean diapers.
We're not asking you to wash dishes.
No,
just
I understand,
changing your
but-
child's diaper.
Right, but it all kind of, it's in a sense, is in the same category of things
It's an
because
ego thing, bro. That's what it is. It's like, why should I do it? I've changed both kids' diapers. I've given bath time, in fact, is my time with the kids.
Mhm.
Until recently, my daughter, obviously, as of last year, she was like, I don't want you to give me a bath anymore. Which again, it's normal. That's
Yeah,
normal.
Very normal.
But prior to that, and I was, mind you, I was like heartbroken as well. I was like, oh my God, she's growing up, bro. But like with my son, me and him, bath time is our time.
so
but you're giving him a bath.
No, he's giving me a bath.
Oh, okay.
Yeah, I get in the tub and
Rubber duckies and everything.
yeah, everything, bro. Could you imagine Alex?
I actually could imagine Alec doing that to you. Papa, sit your ass down. I can't reach your back.
Close your eyes.
But no, it's that old, again, it goes back to that, Soviet communism type of, I do this and you
Okay.
do that. We don't cross barriers.
well, we're not living in the Soviet Union
I-
anymore.
yeah.
And you changing your child's diaper can actually, that little thing that you do can make your wife so
Yeah,
happy.
absolutely.
Just like when you come home, you would like, or in the morning, you would like your coffee or you want a warm meal on the table, which is not comparable to changing a diaper, by the
Mhm.
way. But just like the little things your wife can do for you that would make you happy, that's something that a man should be able to do to make their wife happy, to
Right.
take a little bit of that responsibility off of her.
Look at it this way as well. Put the wife aspect aside for a bit, and don't. You're not doing it for your wife. You're doing it for your kid. Your kid has a dirty diaper, whether they pooped in it, they peed in it, whatever it is.
Mhm.
That 2 to 5 minutes of you changing a diaper is a bonding moment with your child as well. It sounds very awkward, whatever I'm saying, but that kid is looking up at you as you're changing them, and that satisfaction of them being cleaned and having a brand new underwear, diaper, whatever it is that you're putting on them,
Mhm.
there's a bond that takes place there.
Yeah.
There's a trust factor where this kid is trusting you with you changing them, putting clean clothes on them, clean diaper on them. But
Let me give you guys a harsh reality check here. If you're fortunate enough, I'm talking to you guys, to live long enough where you go into your late 80s, 90s, maybe hundreds, there's a very, very high chance you're going to have to start wearing diapers again, and somebody's going to have to change you. So think about that. That's the reality of life.
yeah,
So that's one aspect, and that's a very good perspective to put out there.
It's a little extreme, but
That's extreme.
No,
but-
but it is. So
that's what I deal with. It,
So-
I mean,
one of the ways
you thought mine was bad. Shit. Hold my beer.
one of the things that's important is just really supporting one another.
Yeah.
So if one can't, you can. Relationships are not 50-50.
Yeah.
There's no such thing. And that 50-50 does not work out.
yeah.
Sometimes it's going to be 80-20, sometimes 60-40, whatever. So if you see your spouse can't do something, pick it up. It doesn't matter if you're at work all day. Because if the wife has to go to work, guess what? She's going to come home and continue working.
Yeah.
Yeah. So when you get home, you got to help out. And that's the least you can do. So when you come home after a long day of work, we get it. It's very respectable, amazing that you're taking care of the bills. But that's also your child. So relieving your wife of taking the baby for half hour, an hour, whatever it is, having her shower and maybe cook you a meal, whatever it is. Again, teamwork. It's not I do this, so that means I don't do anything else. That's also your child. So that's one of the things that I see a lot. And it's sad. I don't blame the husband. I don't blame the wife. It's also the way they were raised. It's also what they saw in their family. And once again, we raise our kids the way, and we become husbands and wives typically, not all the time, typically the way we've seen our parents become husbands and wives to one another. We're not taught how to be a good husband and a good wife. We're typically taught how to be a good parent.
And look, if at the end of the day, you don't even know, you're confused as to what am I supposed to do?
Ask your wife,
Ask.
she'll tell you.
Ask what areas would you like me to help you when I get home from work? Would it help you if I vacuumed, or if I changed the diaper, or if I gave the baby a bath? what would you like me to help you with? If you're like, I don't know what to do. I'm just,
Yeah. So if you have a wife who has postpartum anxiety, she's going to say, don't do anything. I don't need you to do anything, because if when you do it, you're going to do it wrong. So then that's going to give her more anxiety. So in therapy, we teach the wife, okay, so you don't have to do it all. Let's learn how to communicate what you need to your husband. So instead of saying, and I'm very transparent with both partners. Okay. So when I bring them in as a couple as well, I'll say, okay, look, you want him to help you, but every time he helps you, you tell him you do it wrong.
Yeah.
Where did you learn how to change a diaper? You didn't do it perfect the first time. And they're like, well, yes. They'll think, okay, let him make mistakes so he can learn how to do it his own way. It's okay if he doesn't put the baby to bed exactly the way you don't do it. Let him figure it out his own way. That's also teaching the baby how to attach to different human beings in a different way, learn different energies. Life is not always the same. So usually we're not setting that schedule for the baby. We're setting that schedule for ourselves, because it decreases our anxiety.
Just and when you think about it, because like the other day, my kids came home from school, and I happened to be home, got home right before them, and like, I don't know if this happens to you guys too, but like, I hugged them, and at that moment, you're like, oh God, I wish I could stop time, because I know there's going to be a day where it's the last time they hug me the way they hug me now. They'll hug me different ways. They'll be teenagers. The teenage hug is not the same as
it's completely different.
I mean, you have teenagers.
Ew.
or it's going to be the last time you're going to give them a bath, as you've experienced. The last time you're going to change their diaper. It's the last time you're going to clean up their toys. There's going to be last time to everything in life. And you're going to miss those days. Like, just think about that, because that's the one thing we can't do, is stop time. And I tell them sometimes, I'm like, I wish you guys would stay this age. I love you so much, because I know you're going to get older. Your friends are going to be more interesting than you hanging out with me. And I understand that. But I'm looking forward to those days, but I'm not.
You bring another one. They replace it,
right?
And then you'll be like Joel. You'll have 7.
I wish, bro.
Well, it's the sentiments you're talking about, and those little things are, I think, stripped away from a lot of men, at least the ones that I've worked with, because they haven't really been taught that growing up. Where even the simplest thing of like giving a bath to your child or changing a diaper is a bonding moment. Most of the time they'll look at you and laugh. And how is that a bonding moment? But they don't understand that. Yeah. So every little, the hug, the shower time, the bedtime, reading a book to your baby, whatever. Those are all little bonding moments. And the importance of a father connecting with their child is as important as the mother connecting to the child, because we need moms and dads. Moms shouldn't be raising their children
alone. And look, it
alone.
gets frustrating sometimes. And that's the reason I brought this up, is because, you get home, let's say, and then they're going, whatever they're doing. And at that moment, and then you get a call from one of your staff or whoever, and they're presenting some stupid issue, and now you got to deal with that. So sometimes your frustration, like, oh God, I just want, but then that split second, you have to pause yourself. At least that's what I do. I'm like, look, this moment of them jumping on my neck there's a couple years left. They're not going to jump. Like, whatever call I got, I don't give a crap. Let whatever is going to happen.
Let them snap my neck. It's more important.
Yeah, I swear. Because, but it's tough, because we all go through that frustration of, you like, I just want to be left alone for 10 minutes. But then you'll have so many 10 minutes to yourself. You're going to like look back and say, God, please, somebody come and ask me the same question 900 times again. Right?
People don't want to enjoy moments. Really, they don't.
But also having that 10 minutes to yourself is important as well.
Look, the 10 minutes will come and go, especially with men. The 10 minutes on the toilet, leave us alone. let us scroll.
No, please. Like, Papa, are you Papa?
Leave us alone. See, there's been multiple times where I take my boy to soccer. My wife will be like, record him for me. Send me some videos. Send me some videos. And unfortunately, I don't, because I'm there to enjoy those moments. So she ends up FaceTiming me, and then I'm just holding the phone like this while I'm looking at him. And look, when they say kids say the darndest things, they seriously do say the darndest things. Like soccer practice is over, and my phone is dead. But anyways, soccer practice is over. He walks up to me and he's sweating, and he goes, "Papa, I have good news and I have bad news." I'm like, "What is it?" He goes, "The good news is I'm frozen." I'm like, "Okay." He goes, "The bad news is I'm melting," because he's sweating. So he's like, it's like, I could have recorded that and had it in my phone forever, but like,
you can't. Have it in your memory.
I'll never forget it.
Yeah.
And you can't. And you're right. You can't capture stuff like that.
No, you can't.
But for the rest of my life, that's going to be embedded in the back of my brain. And when he gets older and he's sweating and he's like a teenager playing soccer, I'm going to remember 4-year-old Alec running up to me and saying, "Papa, I have good news and bad news."
Okay, so let me ask you guys this.
Go ahead.
Would you take your children to therapy?
Just
What type of therapy?
For what?
randomly, or if they need it?
Would you take your children to psychotherapy?
If they need it?
Yeah.
If they need it, yeah.
Okay.
Of course.
How would you know when to take them?
I would ask those 7 questions.
No, but this is important, right? So how do you know when to take somebody to therapy, whether they're young or they're a mom or they're whatever it is? So you have to...
Are there certain signs that we should be looking for? Is that what you're trying to say?
Would you pick that up during communication, like during school drives or?
Yeah, I mean, if you see their anxiety is getting the worst or the best of them and they're not able to function.
So that would be one way, I guess.
So anytime you're thinking or behaving, just think of it this way. I'm going to put it in very elementary terms. Anytime you're thinking and behaving is getting in the way of you actually functioning in your daily routine, and it's consistent, more than like 2-3 months.
If they're struggling with something,
you want to. So with moms, for instance, when a mother has, it's interesting when I go back, the way you said that, I've heard that somewhere, and that is very, very true. So I just can't remember where I heard it. But when a mother has a baby, you don't want to leave her. You want to leave her alone, like maybe allow her to just kind of like get herself back together. But you always want to have some sort of community that supports her. And most moms are not going to ask for help. That doesn't mean you don't give it. Even just being there or just kind of keeping an eye out is important. But when you start to see a mother who is not acting like themselves, they're being weird, meaning they're sadder, eye contact's not there, they're a little bit more detached, or they're excessively worried about anything, where they're not showering, they're not taking care of themselves, they're not eating, they're not sleeping. Those are signs that they might need to go to a therapist. Okay, so it's important. That doesn't make them weak, and there's nothing wrong with being weak. There's nothing wrong with, you're going to have to, when you go to the gym, you don't start off strong. You build muscle, and it's the same thing.
Chuck Norris did.
Well, I highly doubt that. He didn't just go there being strong. So you know what I'm saying? So that's therapy. When you go to therapy, you start small and you start to build. We work with your brain, rewiring your brain, picking up the patterns, reducing your symptomology, all the crisis that you're at. So the therapist can pick up on things much faster than you can. So if you have a mother in your home, that new mom, and you see that they're distracted, super anxious, they're not eating, they're not sleeping, they're not being themselves. Like, as a human being, pay attention to your intuition a little bit. It's God speaking from your gut, literally, telling you something is not right. Don't brush it off. Don't, she just had a child, that's why. Or, she'll just get over it. Or, get over it, you're a mother, I had to do it too. That's not something you say. It's, what can I help you with? Just like you said. Or it's, maybe you need to go talk to someone, and there's nothing wrong. We're not going to judge you. Please ask for help. We're here. We'll watch the baby while you go to therapy. If you come to our site, you can bring your babies with you. It's fine. But don't ignore signs and feelings that you have that are so apparent in front of you. But you just don't want to admit it because you're embarrassed of, what will people think if my wife goes to therapy or if my daughter goes to therapy? Really? Who cares what people will think?
Are you living for yourself, or are you living for those people?
Exactly. But a lot of people, and it's not just in our community, a lot of humans, they're so consumed with how they'll be perceived by the external world that they don't live an authentic life. They don't do things that they need to do, which is get help.
Yeah.
So please look out for those signs. That's important.
But at the same token, you don't think that there's a kind of how would you say, kind of like this overuse of emotions these days too in society, where everything is about, let's say a 45-year-old man or woman will do things at work or be responsible about it, and then they'll blame somehow, as a child, this happened to me, so I have zero sense of responsibility or punctuality, or like, I sometimes think it's also being overused and I've mentioned this, I think, last time you were, where people are overdiagnosed and overlabeled because, ICD-10 code, you got to put this code to, build this and build that. So everybody has a I walk around with, I have diabetes, somewhat bipolarism.
And I'm autistic.
Oh, yeah.
So, it's
That's
like,
a common thing
isn't it?
nowadays.
Isn't it a little being kind of used and abused in a sense, right?
In especially people diagnosing themselves. Could we, if just for a very brief moment, if we can go to the autism thing, please stop taking autism tests on Instagram.
No, you're kidding me.
Okay.
You're kidding me.
This is a thing?
Autism is a very serious developmental disorder.
Autism.
There are many. You need to.
Did you say autism tests on Instagram?
Yes.
What's worse, IQ tests on Instagram or autism tests?
No, your IQ test, you can at least understand it. It makes sense. You can't do an autism test with, if you score 1 to 6, you're slightly autistic.
I think that's how Constantine diagnosed himself.
This is a real thing that's happening. So please stop. Not everybody is autism is a very serious thing, and it's actually very disrespectful when people are self-diagnosing themselves as being autistic because they don't know how to communicate and connect to people. It's so disrespectful to the parents who actually have children who are diagnosed with autism, who do struggle with that. It's a serious thing.
Absolutely.
So you can't go and take a test and pick a color, and if you see it this way, you're... No, maybe you should go out and engage with human beings, and you won't be so antisocial.
It's like, oh shit, I'm colorblind. I must be
you pick purple, huh? You're level 2 autistic.
Yeah, well, I swear, there's actual things like that. It pops up. So that was that.
Since
Please
the 3
don't.
people are also retarded.
If you want to, go spend the thousands of dollars that it takes for the hours that psychologists who are specifically trained to diagnose autism, for them to do all those assessments on you.
They'll be out of there in 10 minutes because they'll be like, oh my God, I can't deal with this shit.
Exactly. So please allow therapists and doctors to do their job, and don't diagnose yourself off Instagram and Google.
Or WebMD.
At this point, ChatGPT and Gemini.
Yeah. So anyways, we're going to go back to the thing, because it's important, especially again with mental health and stuff like that. So don't ignore signs.
Yeah.
Most of the time when I talk to family members of the patient who comes into therapy, I tell them, did you realize anything just off? And they're like, yeah, but I didn't think much of it. Okay. And that's normal. I'll give it to them. But it was more like they consistently saw or felt something was off. Again, ego, pride, it's embarrassing. How will not everybody needs to know you're in therapy. Fine, that's fine. But it's an important thing that we acknowledge that mental health is one of the most important things that we can take care of. For goodness sake, your whole life is controlled by your thinking patterns and your brain. Why not take care of it?
Yeah, and not only in the United States, well, specifically in California, but throughout the United States, we're dealing with mental health crisis all over.
Yeah.
I mean, we're just in our backyard alone. I mean, you're seeing it all over Los Angeles. Areas like Beverly Hills, Studio City, Sherman Oaks, Encino, where people would run to go to the restaurants and hang out on the streets. It's like once it gets dark in certain neighborhoods, people don't want to be out there because of the mental health crisis. And again, drug abuse has a lot to do with it as well. But in order to abuse those drugs, those people had some sort of mental disorder.
Yes, but also I think COVID had a lot to play with people kind of isolating themselves and being home.
As far as kind of what jump starting the mental health, absolutely, I agree with that.
And then social media made it worse. Social media is horrible.
It's a double-edged sword, Irene.
No, I feel like it's horrible.
It's horrible, but it's a double-edged sword because look, at the end of the day, what we're doing right now is social media. We're bringing awareness to people. What you're doing, especially with your Instagram posts and your questions and people interacting with you, is helping people. So that's why I say it's a double-edged sword. If you didn't have it, how would we be communicating to people? How would you be communicating with people?
I'll give it to you. Yeah, that's true.
So that's the only thing. Everything else, it's negative.
Instagram is just basically porn, pedophiles, and just.
Hey, when I said it, you guys laughed at me. No.
Yeah, and other shit like that. That's it. And Facebook now is just marketplace. But you want to buy something, you say, "Is this available?" They say yes, and then they just go away.
What's with that?
I don't know, man.
And then my favorite is also off Facebook Marketplace a little bit. OfferUp, somehow they think like everybody that's trying to sell something desperately needs that money like today. Because you put something like, for example, for $2,000, I'll give you $400. Like,
and I'll pick it up.
Like, what do you mean you give it $400? I mean, it's a Harley Davidson.
Bro, I put our couches on OfferUp. And I put it for like $800, right? The guy's like, "I'll give you $200 and I'll pick it up." I'm like, "Well, I wasn't planning on delivering it to you."
If you do 180, I'll deliver it and see what they say.
So, can I ask you guys something? Have you ever gone to couples therapy?
No.
Couples, no, but I've gone in individual myself. Yeah.
Would you be open to going to couples therapy and getting like just a little, how like a checkup on how your relationship is going?
Just open up a can of worms, right?
Do we have a QR code that we're going to be scanning for a free consultation?
Yeah, what if it was offered to you for free just to go and get a relationship checkup?
Sure.
I think she's curious because she wants to know, these guys talk on the show. I wonder what their wives think of them. Yeah, he never changed diapers. He never looked at it. Never had the baby.
He doesn't change diapers. He doesn't do bath time.
No, I'm not saying it that reason. Reason being is that a lot of us, we don't practice what we preach. And this is what happens in families when a new mother has a baby. People that are telling them to do things are not actually practicing what they're preaching.
Look, nobody is perfect.
No one's perfect.
There are certain things that we do preach. And then, yes, there are times where we forget to practice what we preach. Are there things that we forget? Yes. Are there things that we don't forget? Absolutely.
Yeah.
But look, again, nobody is perfect.
They're not. However, I would like to kind of put this out there. If you are ever going to criticize a mother or a father in the way that they're raising their child because you did it different, let's say, ask yourself, were you happy?
Say that one more time. Wait.
So
say that one more
who's
time.
the criticism coming from?
It's coming from, let's say, in-laws or parents.
So somebody of a different generation.
Yeah. So let's say, as a parent, you're criticizing your daughter for raising the way or being the way she is. Let's say she's going through postpartum depression and you're telling her, what's wrong with you? Snap out of it. You have a child. You need to be responsible. You put yourself last. First comes your child and then comes your husband and then you come. And I've heard this all. I'm not making it up.
Mm-hmm.
Because I did that. Like, that's what they say. Like, this is what I did. I had to hold the family. Were you happy? Were you happy putting everybody before you?
Yeah.
And it's so hard for people to admit that, most of the time, actually.
But you know what the response is going to be? The response is going to be, I might have not been happy, but it was what's right.
Yeah.
But it was a sacrifice as well.
So. But why would you have to sacrifice yourself?
In regard to...
If you're not taking care of yourself, if you didn't eat well, let's say you said, no, I can't. I need to make sure that my kids are eating. I need to make sure that my kids have a good home. I need to make sure they're sleeping. They're doing
That's priority to them. That's how they're wired.
I get it. So one of the things to ask ourselves because we can't change the past generation, clearly.
Mm-hmm.
Again, that's just the way they were raised. That's their life. But now we have to look at ourselves and how we're contributing to the dysfunction in our own culture, right? We're going to be those people in just a few years, apparently.
Yeah.
So if we're criticizing someone, we should ask ourselves, well, were we happy doing things to be right or to look good? So it's just something that we have to think about, is look at ourselves and how we're continuing to contribute to the dysfunction in our culture.
Well, our culture is changing, especially in the United States. We've somewhat assimilated and kind of, you would say, changed as far as society and culture, because an Armenian in America is very, very different than an Armenian in Armenia.
Yes.
And
mentality wise,
everything, mentality, culture, all of it. I mean, even at this point, food, there's certain spices and stuff that they may even argue about. But and you see this when you go to visit Armenia, you realize that old kind of Soviet stigma is still there, and it becomes somewhat of a culture shock for you because you're so used to being raised in the United States, where it's a little bit different.
Yeah.
That amot factor is not as prevalent.
Yeah, we definitely need the amot back in a way, in a healthy way.
In a healthy way.
Like for instance, judging people for things that they do when they have a mental illness. You know, there's a lot of stuff that sometimes is said, which is very mean. But then again, they're ignorant. They don't know better. And you can't have a conversation with somebody who is not able to comprehend what you're trying to tell them. You know, so with the things that are happening right now, the situation that happened right now, I think one of the most important things to think about before you open your mouth or start typing something online is that, first of all, it's none of your business because you don't know what happened. Second of all, it's not a reality show. This is a real thing that happened. And be careful what you put out there. Be kind. If you don't have something nice to say, don't say it because you're ignorant and you don't believe in mental health and you think it's this or that. It doesn't mean you have to say it. Keep it to yourself.
Yeah. I mean, look at it this way. I always say treat others the way you would want to be treated, but always ask yourself, when you're putting a comment out there, how would you feel if they put that same comment towards one of your posts?
They don't think about that. So I think one of the things to maybe just keep in mind is that if you see someone struggling, sometimes you don't even have to really talk to them. Sometimes even asking the question, how are you, is the most annoying thing to hear.
Really?
Of course.
No.
Of course. Because when you're depressed, people keep, how are you? How are you? How are you? But they don't know what else to say after that. Let's say you actually are depressed and you're like, well, let's say I tried to kill myself last week, but I didn't tell anybody. I isolated myself. I didn't talk to him. I drank.
Okay, that's an extreme.
So
Irene.
no, I'm saying because that's the only way we can understand it, right? So if you're depressed, you really, yeah. Like, what does that even mean?
Exactly.
Because why? Because you're not talking to a therapist. You're talking to a human being who, yes, after they ask you, how are you? Most of the time, they don't know what to do with the information you're going to give to them.
Do you think that's a problem with communication in today's society?
No, that's just a general thing. When you speak to a human being, I say therapist and human being like if we're aliens or something, but
lizard people.
Yeah. Men in Black. It's, if you see someone struggling, just sometimes asking them, what can I do for you, is better than, how are you?
Well, that's
you're going to be okay.
That's what the next question should be. If you ask somebody,
that's not usually the next question. The next question is, first is, how are you? Second is, I've been through it too, and this is what helped me. Yeah. Have you tried that? You don't always have to fix someone's problem yourself. Sometimes it's you just being there, checking in and just saying, so what did you eat today? You know, how was your day? Or did you checking in with them on different levels.
See, that has to do with communication. A lot of people don't know how to freaking communicate with each other verbally. Via text, maybe. Armon's mentioned multiple times where he's seen this generation of kids sitting at a restaurant texting each other.
Oh yeah, I've seen that.
Like
too.
they're sitting there, but they're
Sending
texting
each
each other,
other memes.
messages or whatever.
Yeah.
But like communicating with each other. Look, we've had conversations with people where I've called friends, family members, just to check up on them. How you doing?
Yeah.
You know, I'm struggling a little bit. Well, what's going on? Talk to me. Is there something I could do to help you?
Mhm.
Is there some advice I could give you? See, these are the little kind of conversations where it literally kind of turns into and I always joke around with them. I go, look, our my 5-minute check-in with you turned into a 30-40 minute podcast. And then they laugh about it.
Yeah.
And that's kind of like, I don't know, maybe it sounds cliche to me, but I think that helps bring them up a little bit as far as, hey, you know what? Arno's maybe somebody I could lean on if I ever need something.
But it's also worse in the male population because you guys are pretty harsh on each other. And I get it, you guys communicate different, but
How are we?
How are we harsh? What are you talking about?
I've heard it all in therapy.
Like, what would be an example? I'm curious.
Come on, Irene.
Like a really harsh one?
Yeah.
Yeah.
I like that tone. Like a really harsh one.
I don't know, like stop being a weak ass bee, like not everything.
Oh yeah,
just
yeah.
not
Stop being a weak ass bitch.
Yeah.
Okay, but what if that man is really struggling and they're trying to open up to you because you're their therapy, you're their
Maybe one of the
guide.
problems.
Okay,
Yeah.
so what if
like you are the problem?
you guys? Most men, they struggle in silence because God forbid they open their mouth. We look at them like they're being
men.
weak. Okay,
That's how
I
it is.
understand. Again, men and women are different. Okay, I get it. However, most men struggle in silence, and most women, mothers or women, if we ever do complain, and I'm saying most, this is not all. I'm not overgeneralizing. This is all coming from what I'm hearing. Is if they do complain, it's like, well, somebody else has it worse than you. So why are you complaining? But for that person, that's an issue.
What about the guys who, okay, look, in my opinion, if you're in a friendship where you don't feel happy and you're constantly being criticized and judged, and if you're seeking some sort of advice from that friend and he's calling you a weak ass bitch, then maybe you shouldn't be in that friendship anymore.
Well, no, that's just how men communicate. Maybe because he doesn't know what to tell you. And that's the time you go to therapy.
Well, I mean, once, twice, 3 times. Look, again, I'm not saying that's how I joke with my friends or anything, but if for any reason I did say that to somebody and then they called a second time and they said the same thing, bro, I'm really struggling. At that point, a logical person would say, oh, dude, is everything okay? Like, then you kind of realize that, okay, maybe it's not time to call him names. Maybe it is time to help.
Yeah.
But if you got a friend once, twice, 3 times, 4 times is constantly insulting you, it's like that rope meme. Sometimes it hurts more holding on than it is letting go. Like, let it go. You don't need that person in your life. That's toxic energy.
Or we can all just normalize saying go to therapy.
But see,
it's really that simple. Just normalize saying go to therapy.
Yeah, but there's different scenarios, I think. I don't remember anybody ever in my friendship using that term, you're a weak ass, other than when we would play sports, they're trash talk.
Like some mess around.
But in real life, for example, the only time I could think of where we're like, listen, bro, like man up is because, for instance, if somebody sits there and says, I haven't been able to land a job. Okay. This is how men have conversations. We're not going to talk like women. It's okay, honey. It just takes time. No. Well, how many resumes have you submitted? 1. Oh, 1 in the last 6 months. And you haven't landed a job, huh? Wow, that's too bad. No, we're going to say, what do you mean you've submitted 1?
Okay, you're holding him accountable.
Yeah, so our accountability as men, I agree, we do have that. But there's been times, for example, where friends will come and have a discussion, let's say in private with me. They'll discuss a situation with their significant other about a health issue or their family member or something, or whatever they're worried about. We never, come on, bro, man up. No, it's like, no, it's a serious situation. Let's see what, how I can assist you. If not, I recommend you go talk to Dr. Irene or whoever and see, figure things out.
Dr. Irene. There's a lot of other therapists.
Listen, you'd be surprised how many people we referred out to and giving you shout outs online.
Thank you.
So my
Appreciate
point
that.
is, the weak ass B, I think, would come in. And again, because those situations have happened in my friendship too, where I remember one person was complaining about stuff like that. And we're like, listen, bro, you can't complain about A, B, and C when you haven't taken this attempt, you haven't put effort into this, you haven't done that. Like sitting at home, nobody's going to drop a new job for you, a new this, lad.
But that's different. That's different than them actually. I'm so sorry for cutting your word, by the way.
It's okay. I apologize for speaking while you were interrupting me. Go ahead.
Wow, that's gaslighting on another level, by the way. And that, everybody, is gaslighting.
That's why I need therapy. I'm a gaslighter. Go ahead.
My point is
he's been waiting months for that, by the way.
That was good, though.
You got it. My point is, don't ignore. Don't ignore signs. Don't ignore things being off. Don't ignore people not being themselves.
Yeah.
There's a reason. And it's very simple. Just like we have normalized a lot of other terminology in our life, we can, normalize, go to therapy, go see a therapist. That's totally fine. Well, I'm not crazy. You don't have to be crazy. Just go see a therapist. Typically, we get our referrals through people already knowing how we work. So if you work with someone, refer them to your own therapist. That's totally fine. Do we have any questions?
We do. Let's
go through those questions because I want to.
You're tired of us?
No, I just want to answer the question. People have taken time to ask questions. I want to.
By the way, did you have any questions on your IG that you posted?
I did. Yeah.
Did you want to? Okay.
I will. I want to. I feel bad. They're like right here.
Here we go.
What do we got?
Do healthcare providers also check for signs during baby health visits? So I think they're referencing.
Yes, to an MD. I'm hoping. I'm not a medical doctor, but you could definitely maybe bring that up. If you have a pregnant wife, or if you're pregnant, when you go to the doctor, have them do that assessment on you. Tell them, say, can you give me like a mental health assessment? Or you can actually go to a therapist and get an assessment done. We can do like a prenatal assessment on you. But I don't know how doctors work. I'm assuming if you're a pediatric doctor and kind of...
listen guys,
should.
Be proactive. Don't expect the doctor to notice something or your neighbor to notice because of you be proactive about it.
Yeah, but sometimes they don't know. That's
why. Well,
that's actually a good question.
I mean, that's what I'm not saying it's a bad question. All I'm saying is it's good to be proactive. If you're feeling something or, you see, like, as you mentioned, your spouse they're off or something, talk about it, bring it up, see, what's concerning them.
If you don't feel like yourself or your significant other isn't acting like themselves,
reach out for help.
Yeah. Talk to somebody.
Yeah. Next question.
Anything?
There's more statements than anything else.
Go ahead. We can read the statements.
Okay. I think those were saying...
I think those are serious. Okay. Can you make it larger a little bit? Can you make it bigger?
Yeah,
I'll read it, guys.
Hold on,
I think those who are serious about the serious saying, don't be weak. You shouldn't surround yourself with them. But in general, most guys will joke, but then sit down and seriously listen to you.
Yeah, I'm not making it up. I have a lot of male patients who say their friends are very harsh on them. Their uncles are very harsh on them.
But about what, though, specifically? That's the thing.
I think
don't
just
complain about your mental health.
It's bullying. Be a man.
But to them, it's not bullying. It's tough love. Tough love. But yes, they are very serious comments. That's very, he's right or she's right.
Yeah. I mean, look, tough love is okay. I'm okay with tough love, but to a certain extent.
True.
Here's another one.
True.
If you're constantly bullying family members, friends and stuff, then that's a different story.
Why is there such a strong emphasis on therapy these days?
Because people are killing themselves out of nowhere. And they're very depressed. And they don't know how to deal with their depression. Social media has increased dramatically in the past, let's say 10 years, which contributes to people comparing themselves to people on social media. And also, people have realized that therapy works. When you have an issue and you go to a good therapist, and they're able to walk you through your demons and your problems, Therapy is emphasized because therapy actually works. And there's so much that we can prevent from happening, including death, if you can just get the person into therapy.
Look at the rates of suicide, look at the rates of depression, look at the rates of anxiety, and look at the rates of divorce.
There's an actual crisis, an epidemic happening right now when it comes to mental health. I believe Nevada was rated the worst state.
Wow, really?
With
I
the
wonder
worst
why.
mental health. I mean, gambling, sex,
Of
drugs, all
course.
that. But I think also therapy is something that is becoming the norm, and I'm really glad that's happening because we're not fully there yet, but it's becoming normal to go to therapy and ask, or even just get a mental health checkup.
And
I've
again,
always said this: once a year, go get a mental health checkup.
And again, this might be something where, whether it's Dr. Irene you visit or anybody else, where you'll go in there one time, they'll do a diagnosis on you, and
But we don't always diagnose. Sometimes there's a V code. A V code is basically something that, let's say you're having parent-child relational issues. That's not a diagnosis.
or they'll
That's an
have
issue you're
have
having.
1 or 2 conversations or sessions with you,
Yeah.
and you'll be like, you know what? All right,
Yeah.
I think we're okay.
Yeah.
And then there's obviously those that need constant.
It depends
Therapy.
on the patient.
Yes.
So
Last time I went to a therapist, at the end he was like, "Listen, after you, I need to go to therapy." I said, "Well, I'm available." If you,
They switch seats.
we switched suites.
and then he came
Yeah.
to me. No, I'm just kidding. Your therapist came to me.
But speaking of social media, there's a very short quote
Mhm.
that I think is the epitome of what's going on. Is the quote says, "Comparison is the thief of joy."
Mm.
And that's what's happening to people. They have no joy because they're comparing everything to nonsense, artificial bullshit. So they're
Yeah.
basically robbing themselves of their own joy.
Yeah, Joe, I sent you a video via text message. Do you have your text messages on your
I do.
laptop?
Let me see.
Okay,
Open with caution.
Yes, that's what I'm.
We don't
very
have any other
careful.
questions.
We do not
Okay.
at the moment.
it's in that one. Yeah,
It's on
okay.
this one. Okay.
click on that video.
Give me 1 second. I gotta share the screen in order to do that.
What is that?
Well, click on it. It'll take you to IG first. There you
Yeah.
go. Okay, so pause it. This is what
Okay.
I wanted to share.
Who is this?
It doesn't matter who it is. Look at
Give
how
me 1 second.
I'm so
Let me share.
blind. I'm
Let
like-
me,
I know
let,
that
me,
we're all blind.
let me share the screen, guys. Give me 1 second.
I mean, there are like 12 lights staring at us.
Is
so-
it this one?
Yeah.
Yeah.
Okay, share this really quickly.
Okay.
So
Let's see what we're watching.
Give it 1 second. I'm gonna change the view.
there you go.
All right.
So look at this video. This is the video that I was talking about. And Joe, can we make it full screen or no? There's no way.
Sure we can.
Like, look. She puts her baby to sleep. She goes to bed. Camera's running. It's like, this is not reality. So now she's in another room. And now she's in the room again. You're telling me she's moving tripods. She's doing. See, this is what we were talking about when I was mentioning the camera angle changes, the waking up, and it's unfortunate that there are moms out there that watch this stuff and they go, "Oh my God, that's me. That's how I am as well. I wake up at 10 o'clock and I feed my baby and I have to cradle them and then hold them and then put them back in their crib." But
And have perfect hair while you get out of bed. And
her
your
hair,
clean
did you see her
pajamas.
makeup as well?
Okay.
Flawless
so that's
contouring.
Entertainment. Maybe she gets paid for her videos. I don't know. Maybe that's a stay-at-home mom who's making money by making reels. We don't know. We can't judge. We listen. We don't judge. We listen.
There's only
we
one.
watch,
There's
we
only
don't
one person
judge.
that can judge. I'm not judging.
We do. I have another question. This is an
Sure.
actually interesting one. I
Mhm.
find this one right here. Do therapists need to see therapists themselves at least once a year?
Yes, amazing question. So my nonprofit that I have, Hillside Wellness, we're a training site, and we're contracted with schools that we interview practicum students, and then we take them on, and we will train them. We have a mandatory. Oh my God, it's really late today right now. We mandate. What is the freaking word?
Require?
Thank you so much.
Mandatory mandate
We
required.
we require all of the therapists to be in therapy themselves. I refuse to train any therapist that is not in therapy themselves. Now, after that, are we required to be in therapy? No, but I think you should absolutely be in therapy if you're a therapist. I have my own therapist. I mean, I see him when I need to. There was
How
a time
often
in
do
my
you
life.
need to?
Not often these days, thankfully.
I haven't seen him in 5 years, but you know.
No. I do see him, every, like, I will make sure to make a point, like if maybe I'm having a lot more trauma cases that month, I'll see him so I can just, work on some stuff. But there was a time in my life that I was severely depressed for about 3 years, and I saw my therapist like 3 days a week.
3 years?
Yes. So it was just, my dad passed away last year in October.
Sorry.
Sorry.
Thank you. It's okay. It's just part of life, sadly. But yeah, I went and I saw my therapist. Of course, my therapist knows everything about me. I go back to him when needed. And I don't need to go every week. I'm not really struggling.
So how
as
do they
much.
know everything about all the patients they have? Like, for example, if your therapist has, I don't know, 500 other patients,
Mhm.
and then you go, how does he remember everything you've talked about? And
Yeah, well, we take progress notes after each session.
Mhm.
So, of course, another thing that is different from your therapeutic friends, we are required to hold medical records, which is called a progress note. So we can.
Thank you, Irene. Thank you.
You're welcome.
I appreciate it.
That's what I'm here
I'm going
for.
to change the group chat.
Yeah,
name to
therapeutic.
So after every session, we complete a progress note, which includes your mental status exam, and then how you're doing in regards to your goals. And then when you're done with therapy, we complete a discharge summary. And then if you come back to therapy, we refer back to that to kind of see what we were working on, where you were at. And of course, you're going to complete a new assessment. So we're going to see where you are and then move forward from there.
Are we allowed to see the therapist notes or no?
For violation, maybe?
No, you're
No,
allowed
it's
to
not
see
a
your
hit.
own notes, but I mean,
It's not a hit.
Oh, is it?
It's
Oh, I
This is the
thought
thing.
you wanted
so
to see
if you
your
ever,
notes.
if you, no, you can't see my therapist. But okay, so if you ever want to
wanna see your
request
therapist.
You
no,
want to see him as well now?
Jesus
That would-
Christ, for sure.
that would be interesting.
Yeah.
So yes, you can request your notes. I don't know what you're going to understand of it because it's all clinical mumbo jumbo. So what you can do is request a summary of your treatment from your therapist. It takes them about a week or so to get everything prepared, review everything, write down what your diagnosis was, what you're working on, where you are, what they think you should work on, what referrals they have, and they give it to you. It's called a psychotherapy summary.
Like my therapy sessions.
You know what? I just,
That was like the bitch comment, basically.
what I just remembered when
No.
when I was going through my CCW psych exam,
Mhm.
I couldn't believe it. Like the written exam.
They diagnosed him crazy.
No.
Can't have a serious situation.
They said, "Sir, we're gonna have to confiscate your Swiss knife."
And please wear this helmet at all times. God, sorry.
No, like
Guys, we're talking mental health.
Yeah, does you know how healthy this is?
We definitely need it right here.
7 years I've been dealing with this guy.
You guys should do
Almost
like therapy together sometimes. I'm sure there's.
Oh
Isn't
my
this
God.
what we're doing right now?
Yeah. Somebody's gonna piss themselves.
so. Both the written and the telehealth, which exam or psych evaluation, whatever it's called. Like, especially the written exam was almost 45 minutes. 95% of the questions were like related to pedophilia. And I'm thinking to myself,
Where do you work? Where do you?
this was it's for a license to
CCW
carry.
is concealed carry firearm.
I'm thinking to myself, I'm not
Oh,
applying to be a preschool teacher or like going to,
Hmm.
some child, whatever, foster care home.
Yeah.
I'm applying for my Second Amendment, and 95% of the questions you're asking me is if I've thought about doing this to kids or that to kids. Like,
I think
does
it's
that
more
have to
so
do?
assessing what the probability is of you actually harming someone or a child. That's actually a very good point you're bringing up. Yes, I
You're welcome.
understand. Thank you. I understand that it's frustrating what you need to go through in order to have a gun in your house, but there's a reason why we put you through so much before we give you a gun, because things happen.
No, I understand, but why the child pedophilia?
I don't know.
questions?
Maybe that's something. I don't know. I'm not the one. I don't know the psychology behind why they ask
She
the
didn't write
questions
the
the way
test.
they ask. But I'm assuming it's assessing different thought patterns and what I'm just assuming, and what your probability is of hurting.
Okay, 20% fine. But literally
I don't know.
9 out of 10 questions was, and then in different ways. Have you thought about doing this to? I'm like, why are you asking?
I don't know.
these
That's a
questions?
good question. That's actually something you should ask, and I would love to understand it too.
That's something
there
to
was
investigate now.
There was something I wanted to say before we end, but
Talk to us. Tell us.
I forgot. I was.
Would you be our therapist?
Yeah,
Couples
absolutely. A couples therapy. Yeah.
No. Well, you said we should do therapy together.
Yeah.
Maybe we could take advantage of that QR code.
Pop a
Hey,
5 milligram gummy and show up.
That's actually not healthy, because now we're not
What are you
working
talking
with
about?
your brain.
Yeah, you are. It's just
But-
me in a different psychedelic state.
I think one of the other things, lastly, we should touch upon is trauma and how prevalent it is. Just being human, we endure a lot of trauma in our life, some more so than others. But having a child is a bit traumatizing for most mothers. And most of them don't tell you how traumatizing it was. And I mean,
All men out there, every single husband out there, if your wife is pregnant and she's giving birth, be by her side.
Yeah, and avoid
very
telling
important.
her that you're not the only person who gave birth on this planet.
Don't send your mom or mother-in-law or sister-in-law to go hold your wife's hand while she's giving birth to your child. Be by your wife's side, hold your wife's hand.
Don't go downstairs drinking with your friends.
Yeah. And then don't come upstairs with a bunch of sushi and burgers and flowers and
Smoke.
smoke
Who do you
cans.
guys hang out with?
We don't hang out with them.
Oh.
There's just these are stories.
Have you been to the maternity wards?
Adventist.
I have heard stories, but I didn't know they were true.
These are stories. No. These are stories. Look, In-N-Out is across the street for a reason.
Well, but speaking about trauma, since everybody's on Instagram nowadays, and vicarious trauma is a real thing that happens. Vicarious trauma is basically you watching a traumatic incident
Traumatizes
and your mind thinking it's actually happening to you.
No.
Yeah, it happened to the fire victims. Mm-hmm.
Hold on. They watch a
So
traumatic
let's say-
event on Instagram, like a video?
Yeah, you can watch. Okay, most of the stuff on Instagram that's super traumatic, you should not be seeing people getting murdered and stuff like that. So most of the stuff we see on Instagram that's very brutal, our eyes were not meant to see that. Our psyche was not meant to process that. We're becoming very desensitized to very horrible things.
Well, those are the
Yeah.
reels that get shared
So-
the most if you look at it.
Absolutely. So one of the things that we have to be careful with is, especially when we're hearing stories that happen, is not to constantly want to search for new things and new information and constantly talk about it and constantly look at pictures or this or that, because vicarious trauma is a real thing and you're basically making your mind think that that's happening to you. So you're traumatizing yourself.
And people have become numb to it because it's, look, I hate saying this, but when the news broke out about the family that unfortunately lost their lives, there were people in the messages saying, is there a video? It's like, dude, are you freaking crazy?
Yeah, because everything's videotaped. Well, not videotaped, but recorded.
But it's like, dude, is that's the first thing that's crossing your mind? Is there a video?
Yeah.
I mean, it's that,
Complete
those
desensitization.
well, those are the people that need therapy, and those are the people that need psychiatric help, seriously. Because if that's the first, instead of you thinking that, you know what, God be with that family, I hope I give that family as much strength as possible to get through this. The first thing you think of is there a video? You are, I mean, there's no words to explain how sick you are in that.
Yeah. So it's traumatic and it's sad. And I think that we need to all be kind and not use it as a reality show.
Agree.
I think we had a couple more last questions.
Yeah.
Let's get
What
to it
were
then.
they?
One was
What is that sign?
Which sign?
Which sign?
Is somebody laughing?
Oh yeah, they were
Oh.
laughing
That was
at our
earlier.
comments.
You and I are.
I can't
You and
see
I are
from
both.
here. I guess I'm like, what is that?
Which one are you?
It says, how can a therapist's progress reports be shared with law enforcement if there is supposed to be confidentiality between therapist and individual? And then doesn't that violate therapist-patient confidentiality?
The only way your file can be, if you have a subpoena, if there's a subpoena that's ordered, no, a police officer can't just come and say, I want this person's records. We'll tell them, we don't even treat that person. We don't know what you're talking about.
Yeah, HIPAA.
So I don't know I don't understand I don't know where they're coming from.
I don't know where
they probably have gone. There's something that happened that they're asking this question.
Yeah.
I don't know if they maybe misunderstood where you said you can request reports.
Yeah. So what I'm talking about
patient.
is, as a patient, you can request your own progress notes or your file from your therapist. But what I was saying is, to make your life easier, is to request a summary so that you just have like one page to read. However, if you have a release of information with your psychiatrist, like for instance, if I have a patient and they're also being treated by a psychiatrist, I always get a release of information so that I can consult with that psychiatrist, so that the psychiatrist and myself are working hand in hand and we're on the same page about the patient. So that is another way that your progress notes may be shared. Another way is if you get into any kind of legal trouble and you tell people that you're in therapy, and then they can subpoena.
Yeah, because even if, God forbid, your child, who is already 18 years old, ends up in a, let's say, psych ward or something, there's nothing you can do to, they won't even tell you your son or daughter is there.
Yeah, and also if you ended up in a psych ward, the psych ward can't just contact your therapist and say, we're requesting their file. That doesn't happen.
Yeah.
And we can't do that either. We can't say, oh, my patient is there. They won't even confirm or deny. We would have to have a release of information signed by the patient or the person who's taking care of the patient, the responsible one, in order for us to share anything. So your stuff is confidential. Yes.
Yeah, mental health is the toughest of HIPAA laws.
Yes.
I mean, it's
it
very,
has to
very
be.
secure.
We know all your secrets.
We have one more question.
What are we at?
Right here. After finishing a course of therapy sessions, what are signs? What are signs one that can recognize that they need to come back to therapy? Basically, what are signs that someone needs to come back to therapy
After finishing therapy?
Yeah.
That you're not doing well still. So if you're still not feeling well, just go back to therapy.
If you're still not yourself, basically.
Yeah.
Anything else?
I think that's pretty
Personal
much
thanks.
Irene? Should you say it as well?
Yeah.
What would you say?
I said anything.
We both said anything else.
Yes, I was actually trying to answer the questions in the sentences that I was saying that were asked.
Mm-hmm.
How do you know it's time to call it quits in a relationship?
Where was this?
This is her personal IG where she put out the post.
Oh, gotcha.
That's a broad question. I mean,
it's a pretty specific one. Like, how do you know when to end a relationship?
It depends on the problems that you're having, though.
I think go to therapy. But to me, I would say if you truly feel like you have done everything, including therapy, and anything, including therapy, and nothing is working, like you have really given it your 100 million%. So,
call it quits.
Yeah. So but most people in their relationship before they try everything, including therapy. I cannot emphasize how important it is. Honestly.
Did you guys know that Dr. Irene's a therapist?
Oh, I didn't.
By the way, I'm a
Seriously?
therapist. Yeah.
Oh, are
I went
you?
to school for ever for it. So
We should start all over again. Happy Monday, everybody.
happy Monday.
Great to see
I'm
you,
Dr.
everybody.
Irene. So yes. Oh, and there was one more. How to stop overthinking.
Oh,
So-
that's a good one.
Yeah. So overthinking is sometimes an obsessive and a compulsive thing that happens. And just because you're overthinking does not mean you have obsessive compulsive personality disorder or disorder. That's it's a serious disorder. Everybody thinks they have OCD these days. How to stop overthinking? One of the things, again, sorry, I'm going to repeat it again. Go to therapy so that we can figure out what is it that you're so obsessively thinking about and why, what have you tried? And then how we can move you through to kind of getting a relief of what you're thinking about. I mean, are you thinking about finances? Most men, they say, I can't sleep at night because all I'm thinking about is how I'm going to pay the bills. Okay. So how much is that helping you actually realistically? Sitting there and thinking about it. It's like you said, what are you doing about it, right? We would say that in therapy. So you're saying this, but you're doing that. So your behavior is not matching your words, right? So if you're overthinking, ask yourself, what am I overthinking about and how is it helping me? And if you're unable to stop or reduce, we don't want to stop. You're always going to think. You're not going to stop it. Just like you're never going to never be depressed or never be anxious. It's a part of the human experience. You're going to have depressed chapters. You're going to have anxious chapters. You're going to have traumatizing chapters. So ask yourself those questions and like, what am I overthinking? How is it helping me? What have I tried to do? And if you've tried everything and it's just not working, go see a therapist. They'll help you assess yourself and figure out better ways to cope with your stress. Typically, overthinking is anxiety. So when we look at anxiety, anxiety is the symptomology that presents itself. Underneath it, it is the fear of the unknown. Okay, so you don't know what's going to happen. So you're scared of what might happen. So your body then reacts through your symptomology of anxiety, of you overthinking, over worrying, having a panic attack, hyperventilating. Yeah. So your body is spewing out and basically having like an exorcism, like trying to push it out because you're not dealing with it verbally and psychologically. So you're somatically now dealing with the consequences of you overthinking.
Yeah, and dealing with anxiety, do not take other avenues to deal with anxiety.
You know, it's a very interesting thing. The most psychologically, the people that I've worked with that struggle the most psychologically are the ones that go to the gym a lot.
Insecurity?
No, the gym is their outlet.
That's how it helps some.
The gym is their outlet, but it's also their distraction.
Yeah.
I've met the most psychologically unhealthiest people at the gym. Physically, they looked amazing. I wish I had their body, but psychologically, the anxiety and the depression was off the charts.
Yeah.
They'll go to the gym, but they won't go see a therapist. Because
so if you're not working out,
no,
you're doing something right.
Yeah, no.
If you're working out,
is that what we got from this?
If you're working out, stop and go to a therapist.
No, what I'm saying,
what we got from
you guys
this.
will see it. Talk to people at the gym. The thing is that it's easier to face yourself in the mirror, but it's not really easy to actually face your own demons that live in your head.
Yeah.
Which is what therapy forces you to do, is to look at yourself. Really look at yourself. Not how you look on the outside, but how you feel in the inside.
No, yeah, in the inside.
Pero it's inside.
Yeah, you're emotionally, you can completely destroy yourself. Trust me.
Was that like a Scarface thing?
No, that was
a Nacho Libre. Scarface.
That was Gustavo.
I love how we can laugh about things because humor is a wonderful thing.
Laughter is the best medicine.
Laughter is the best medicine.
Listen, if all else fails, just subscribe to the Wise Nuts.
Oh my God. If all else fails, go to therapy.
Watch us and be like, you know what? Those guys are idiots. I feel better about myself.
Exactly. Look at these jackasses.
Oh, don't say that.
They think they're influencers.
No, we're not influencers. We have zero influence.
We have zero influence. And we're not reporters, by the way, or journalists.
So let me ask you guys this before we end. What did you take from this conversation? Like, how would you guys treat somebody that's struggling with mental health? Maybe one way different. What would you do different?
Oh, no?
Oh, do I have to go first?
Of course.
Do I have to pick on you guys? Now we're in class?
No, I mean, look, man, when it comes to mental health, if somebody is struggling with it and they reach out to me, I'll be the last person to judge them in any way. Okay. I'm always one of the people to lend out a helping hand. But
is there anything you would do different after our conversation?
I tell them to go see a therapist.
Good. See? Very good.
But listen, I've given you a shout out on the show multiple
Thank
times.
you. I appreciate it.
Give me your
It's your turn.
Your turn.
What would you do different? This is his coping, by the way.
Who am I?
Yeah.
Yeah,
What
he's
is?
laughing.
Laughing.
No, just
Good.
Gaslighting, humor, it's all there.
this is my way of dealing with my depression.
He's
man.
buying time, right?
No, it's-
Yeah. He's
Oh.
thinking about what he's going to say.
It's
Go on,
okay.
take your time.
I don't even know what I'm gonna say.
This fucking
Joe,
pillow.
you go before me.
I have no idea what we're even
You don't
talking
know.
about. I'm
You
controlling
don't
the
know
camera
what you would
system.
do. What would you do different?
You
One
get
thing
rid of
you
that
would do
pillow.
different.
Yeah, definitely.
Yeah,
Please
is
get
that
rid of
like
that pillow.
is that your emotional support pillow? What is it?
I told you they were gonna think that.
No, what is
No,
it?
no. No, it's just
Do you like holding it?
yeah, I feel comfortable.
It
It's
helps
like,
him think.
yeah.
It's like
Well,
me and coffee.
What would I
Let's
do
have it.
differently? I mean, look. Unfortunately, I've dealt with a lot of people who've had mental issues throughout my lifetime, and it's for me. It's always just about. I don't ask them how you're doing or what you're thinking. I don't treat them any differently than anybody else. Just I'll have a conversation with them, but I'll just listen more than I talk so that I could pick up signs of what's going on with them to understand what are they truly dealing with. Is it work related? Is it personal life? Is it insecurities? Is it, for me to have an understanding of what they're dealing with and then I tend to sometimes share different stories without directly in a way for them to feel like, oh, I'm sharing a story because of this situation, but kind of to help them understand that there are other people who deal with a lot of other situations. Then I would ask them, like, have you thought about maybe, seeking a professional? I've done it myself. I've gone to, so-and-so I've had conversations. And I do agree everybody needs therapy, because it could be like I've gone to a therapist because I just wanted to discuss some changes that I wanted to make within my own company, my organization, right? I wanted to process it with somebody different than my business partner or my friends. I wanted to get a different perspective. So I've done that. I've done it for just when I became a father. I wanted to ask some questions about, am I doing things? Is my approach? So for me, it's a very important thing to be able to have discussions outside of your circle, your comfort zone, because it's obviously a different perspective, a professional perspective. Plus, there are certain things you could very likely, or you will definitely share that you may not share it with anybody else, or something may come up that you haven't even thought about because you didn't even know that existed within yourself. So to me, it is, as much as look, we try to make it fun, entertaining. We'll goof around here and there, but to me, mental health, just like, for example, Alzheimer's is a different type of mental illness, but to me, it's the most tragic illness one can get. It's worse than heart disease, worse than cancer, worse than anything else, because you're truly watching your loved one fall apart.
So silent
in front
killer.
of you, silent killer, and there's absolutely nothing you can do.
Cognitive deterioration.
There's no pain meds. There's nothing that you can give to help them out. So do take it seriously, and do call Dr. Irene and whoever you trust or that you know of, that or somebody can refer you to, and
Make sure they're licensed.
yeah.
Yes, please make sure they're licensed or they're supervised by a licensed therapist.
And you may go to one or two that you may not connect with, but the third one may work with you. That you may find a connection with. Don't give up after the first one, thinking, "Oh, this is not," because you just may not have a connection. So, I don't
and
know.
that's okay. That's so good you're saying that. Yeah, that's absolutely fine if you don't have a connection.
You
I
weren't
always say give
expecting
it.
that, right?
No, I was not
You
actually.
thought it was going to be some
you surprised
goofball
me.
answer.
You surprise me every day. So yes, I would always say give your therapist like 3 sessions. The first one, they're just asking you a bunch of questions, and then second, third. If I could go back just to answer that previous question about if we're required to go to therapy. Yes, in practicum, when you're in school and you're doing your master's or doctorate program, you are required to complete a certain amount of individual therapy. It depends on your school. Some require like 25
Wa-
hours. Some require
Was
50.
that the question for the?
Yeah, they said, are
This one?
therapists required to? Yeah. So as a practicum,
I don't think that was
student.
what the question was. I think
Well,
it was more.
if you're a licensed therapist, no, you're not required. I would absolutely say you should be in therapy if you're a therapist. But yes, becoming a therapist, you are required to go to therapy for a certain amount of hours to even graduate from school.
Okay.
Guys didn't know that, did you?
No.
Nope.
You think we just sit down and we just listen to people talk
Yes.
and nod our head
Absolutely.
and
Yes.
say, how does that make you feel?
Yeah.
No, it's much more than that.
Mhm.
That's much more than that.
Mhm.
Okay, just last person. What did?
Oh, what? Okay. Pretty much the reassurance that you have no idea what anyone's going through. That's what I learned from today's show. Kind of reassured me on that. And that's pretty much it. And never judge.
Yeah.
There you go.
I mean, that's what I got.
Well, Dr. Irene, we want to thank you again for taking time to join us.
You're welcome.
It's always a pleasure having you. It's great seeing you outside of this goddamn phone screen. Other than that, we hope to see you again in the future when you could sit down and judge us again. I'm just kidding.
No problem. I'll do it for free.
Of course you will.
Usually I get paid for it.
Of
But
course. No, it's always fun having you here, but we do appreciate it. Thank you so much. Everybody else, today's podcast will be up and running on Spotify, Apple Podcasts, and all major platforms mañana. Have a great week. Have a great weekend. We'll see you guys all next week.
Good night, humans.